Okay, so good morning to all of you. So, very good morning to all of you. And we people have come here for the discussion of pharmacology. And I can see many of you are online. Yes, so Abhinandan, good morning. Dr. Abrar, Dr. Rutik, a very good morning. Yes, Dr. Ranjan, Sahni, Dr. Irfan, Anirudh, a very good morning to all of you guys. So, uh, we have come here for a discussion of some important MCQs. So total approximately 100 MCQs have been allotted to pharmacology, and we have to discuss these MCQs. And it's better if you interact during the class and try to answer the questions, right? Yes, a very good morning to all of you, Dr. Siddhi, Dr. Aman Kumar, Dr. Mausam, Dr. Masoom Raj, sorry, Dr. Vinayak, Dr. Megha, Ayushi Chaudhary. Very good morning to all of you. Yes, Dr. Rupali, Mohan, all of you. I hope you people are studying hard for your exam. So let's start with the first MCQ. Uh, MCQ is which of the following beta blocker are beneficial for the patients with reduced ejection fraction and can also reduce mortality in CHF patient without causing exacerbation over a few years. So what is the answer of this MCQ? So question number one, we have discussed, they are asking the beta blocker that is given for CHF and the drug that will also reduce mortality. Reduce mortality in patients of CHF. What is the answer of this MCQ? Anyone would like to answer? Yes, Dr. Ranjan Sahni has answered. It's bisoprolol. Yes, bisoprolol is the correct answer. Anirudh, very good. It's bisoprolol. So the answer is bisoprolol. So if question is asked to you, in patients of congestive heart failure, which medicines can reduce mortality? Which medicines can reduce mortality, or we can say which medicines can improve survival? Medicines that will reduce mortality or improve survival. The best medicine you will mark is ARNI, and in case ARNI is not given, you will mark the ACE inhibitors. So ARNI is the best medicine, followed by the ACE inhibitor. Then we have the angiotensin receptor blocker. So we have ARNI, ACE inhibitor, angiotensin receptor blocker, and after that you have the other medicines, like we have the medicines aldosterone receptor antagonist. We also have the medicines like beta blocker. We have the drug like SGLT2 inhibitor, and we have a medicine which is combination of isosorbide dinitrite plus hydralazine combination. So guys, these are the total seven medicines. These are the total seven medicines which can reduce mortality in CHF. So whenever question comes to you, which medicines can reduce mortality or improve survival, this is a list of seven medicines that will reduce mortality. That includes beta blocker also. So the best is ARNI, followed by AC inhibitor, then angiotensin receptor blocker, then aldosterone receptor antagonist, followed by beta blocker, SGLT2 inhibitors, and there is a combination isosorbide dinitrite with hydralazine combination. Now, there are three beta blockers which have got approval. The best beta blocker to be given for heart failure is carvedilol. Now, in case carvedilol is not given, you can mark the bisoprolol and metoprolol. So, there are three beta blockers which have got approval for CHF. One is carvedilol. So, first is carvedilol. The second is bisoprolol. The third is metoprolol. So, these are three beta blockers which also have got approval. They can reduce mortality. So, question number one is based on beta blocker, or we can say the CHF, the medicines that will reduce mortality. Now, if the question comes to you, what is the drug of choice for CHF overall? What is the drug of choice for CHF overall? That is a furosemide. So, furosemide is overall the best medicine, but there are seven, but we have discussed the seven topics also which can reduce the mortality. So, Dr. Anna, actually, we are not doing the 5-year MCQs. The management has allotted me some 100 MCQs to be discussed with you people. So, these 100 MCQs can be the prospective MCQs for your exam. This includes all the important topics which can be asked in your exam. the purpose of not putting all the PYQs is like you people have already done with all the PYQs. Like many of you have messaged me also, कि sir, we already mugged up the answers of all PYQ. So if I directly put the PYQ in front of you, there is no rationale of that because you people already know the answer. So better hai, the topics are same. The topics are same, but we have twisted the MCQ so that you can find the same topic in other way. Okay, so this is our main purpose. So let's talk about the question number 2. A patient has come to the emergency department with diarrhea, sweating, excessive lacrimation and salivation. The pulse rate is 55. Pulse rate is 55 and the plasma cholinesterase level is 50. Now, which medicine is given for the treatment of this patient? So anyone would like to answer? So we have started with autonomic nervous system. The beta blocker wala part we people have covered. Now, my next question is, the patient has come to you with some poisoning. Can you find out which poisoning is this and what is the best antidote that we can give? So what is the answer of this MCQ? Yes. So this is a answer is atropine. And can you please tell me which poisoning is this? What is the name of this poisoning? What is the name of this poisoning? Yes, the answer is atropine. This is correct. But what is the name of this poisoning? Like they have given the presentation of which poisoning, guys? Yes, it's a Dr. Abrar has said it's a organophosphate poisoning. So this is a organophosphate poisoning. Irfan also has said the same thing. It's a organophosphate poisoning and atropine is the antidote of choice. Now, my next question, do we give atropine alone or we give atropine along with some other drug? So in the patient of organophosphate poisoning, do we give atropine alone or we give atropine along with some other drug also? So next question, do we give atropine alone or we give it with some other drug? What is the answer? So what is the name of the other drug which is given along with atropine? What is the name of the other medicine that is given along with atropine as a best management of organophosphate poisoning? So atropine is not given alone, it is given along with some other drug. Yes, what is the name of that? Dr. Masoom, I want to know the name of that medicine that is given along with this. So atropine is not given alone, it is given with oxime. Wonderful answer. So they are given with oxime and the name of the drug is pralidoxime. So atropine is given along with pralidoxime, although the antidote of choice is atropine alone, but it is never given alone. It is given with pralidoxime for the fast recovery of the patient. Now, next question is, whenever we give atropine to a patient, we have to give the high dose of the atropine first, and we give the high dose of atropine till the time all secretions will dried up. So we have to give high dose of atropine till all secretions of the body dried up. So when all secretions will dry up, like you can see, the patient will have the sweating, patient will have the lacrimation, salivation. So when all secretions dried up, this is the criteria to reduce the dose of atropine. Now, in case the secretions you cannot check, in case the secretions you cannot check, you check the patient chest. The patient chest should be bilaterally clear. So you have to give the high dose of atropine till the time all secretions will not dried up or the chest will not become bilaterally clear. You have to give the high dose and then you shift to the low dose. Now, if you continue with the high dose, even after that, the patient will develop the atropine toxicity. Patient can develop the atropine toxicity. So we have to reduce the dose after some time. Now, you people also have to tell me about this medicine neostigmine. So where do we use neostigmine as a best antidote? Can anyone of you tell me? Neostigmine can be given for which type of poisoning, like for which type of emergency condition I can use neostigmine. So neostigmine has two important indication. For there it is given as a main drug. So can you please tell me where do we use neostigmine as a drug? Can any one of you tell me where do we use neostigmine as a best medicine? Very good. So Mega has said that neostigmine starts with N. So N is for Nag. So whenever you have a Nag bite, Nag means the neostigmine. So N is for Nag. Nag bite is a cobra bite. And neostigmine is a medicine that we can use. So whenever the patient is bitten by the Nag, that's a uh, cobra bite. This is the medicine that we give. Now, I want to know whether this is the first medicine to give or we give one more thing before neostigmine. So, what is the first thing to be given in patients of cobra bite? So, whenever patient is bitten by the cobra, so in a patient of cobra bite, what is the first thing to be given? The answer is anti-snake venom. So anti-snake venom is the first thing to be given, and after anti-snake venom we give neostigmine. But neostigmine is again not given alone; it is given with low dose of atropine. So anti-snake venom is the first thing to give, followed by the neostigmine, and then the along with atropine. This is how we give the neostigmine. Now, guys, do you know neostigmine is also the drug? It's the best medicine for the reversal. This medicine is also the best medicine for the reversal of skeletal muscle relaxant. So whenever you have to reverse the skeletal muscle relaxant, neostigmine is the best medicine to be given. So the second indication, this medicine is given for the reversal of skeletal muscle relaxant. So neostigmine has two indication. It is given for cobra bite, also given for reversal of skeletal muscle relaxant. And who will tell me, although neostigmine is best medicine for the reversal of all skeletal muscle relaxant, but there are two medicines. Where we give the Sugama Dex. So who will tell me what are the two medicines where we give the Sugama Dex as a best medicine? So what are the two medicines where the Sugama Dex has a better result than the neostigmine? So neostigmine is the best medicine to be given, but Sugama Dex is a drug that is also given for the reversal of two skeletal muscle relaxant. What are the names of those two medicines? So what are the names of those two medicines where give the Sugamadex? Anyone can recall? Yes. So the answer is V-coronium and the rocuronium. Very good, Dr. Prachi, Dr. Ranjan Sahni. The medicines are V-coronium and the rocuronium. So the medicines are V-coronium and rocuronium. And during the class, we made a mnemonic. That's a Virender Sehwag. So we made a mnemonic Viru Sehwag. So Viru means the V-coronium, rocuronium. Sehwag means the Sugamadex. So Sugamadex is given for the V-coronium and the rocuronium. So these medicines are Sugamadex given for these two drugs. Okay. Next is we have a drug epinephrine. Now, epinephrine is a drug. This is the drug of choice for anaphylactic shock. This is the medicine of choice for anaphylactic shock, and this is also the drug of choice for cardiac arrest. So, epinephrine is a medicine. This is the best medicine for anaphylactic shock and the cardiac arrest. And can any one of you tell me where do we use this medicine, benztropine? What is the indication of benztropine? Where do we use benztropine as a drug? So, during the class, we made many mnemonics on benztropine also. So Benz means the Mercedes Benz. If you remember, we made a mnemonic on benztropine, right? So we made a mnemonic on the benztropine. So if you have the Mercedes Benz, then which problem will be solved? So we made a mnemonic during the class, like benzhexol, benztropine, two medicines. Benzhexol, benztropine are two medicines. So we made a mnemonic. If we have the Benz with us, if you have a Mercedes Benz, then the Parkinson's problem will be solved. Parking problem will be solved. So this medicine is given for the treatment of Parkinson's symptoms. This medicine is given for the treatment of Parkinson's symptoms. So we made a mnemonic. If you have a Benz, Mercedes Benz, then your parking problem will be solved. So this is what we have made the mnemonic during the class. It's an anticholinergic medicine. This is an anticholinergic medicine. This is given for Parkinson's symptoms like the tremors. So this is given for the treatment of tremors for the Parkinson's symptoms. The medicine is benzhexol and benztropine. So this is what the mnemonic we have made during the class. So question number 2, answer is atropine. The case is of organophosphate poisoning. Now, if you look at the other case, what is the answer of the other case? Now, in other case, the child has rushed to the emergency department. The child has brought to the emergency department with ingestion of some unknown plant. So once you have got a history of plant, the things are quite clear. But still, if you see the symptoms, the patient is getting the high heartbeat, the skin is warm and dry. Now, if you compare with the above patient, now in the above case, you can see the patient is having a sweating, excessive lacrimation, all those things are there. Now here the patient, and in previous case, the patient heartbeat was 55 only. Now here the heartbeat is just opposite. You can see in the previous case, the heartbeats were 55. In the previous case, the heartbeat was 55. Here, the heartbeat is 150. In the previous case, the patient was having a sweating. Here, the patient will have the dry skin. Here, the patient is having a dry skin, right? So, you can see in the previous case, the patient will have the meiosis. Here, the pupils are dilated and the vowel sounds are sluggish. So, which toxicity is this? Yes, so this is the opposite of organophosphate poisoning. So, in above case, that's a organophosphate poisoning. So organophosphate poisoning is a cholinergic poisoning. Organophosphate poisoning is a cholinergic poisoning where the patient is having a symptoms that we discussed during the class. The mnemonic is dumbbells. But the lower one is a case of Datura poisoning. Lower one is a case of Datura poisoning, which is also known as belladonna poisoning, also known as atropine poisoning. So the below cases, Datura poisoning, belladonna poisoning, atropine poisoning, anticholinergic poisoning. Here the patient is having a symptoms which are opposite to dumbbells. So here the patient is having a symptoms which are opposite to dumbbells. So I can see many of you are marking the opioids. So let me tell you, doctors, opioid poisoning may we will have the meiosis. In opioid poisoning, we will have the meiosis. Like you people must be knowing, whenever we give opioids, the tolerance can be seen against all the actions. Tolerance can be seen against all the actions except the meiosis and the constipation. So opioid poisoning may you people will have the meiosis. So here it is clearly given the pupils are dilated. The moment you will see the pupils are dilated, देखो pupils are dilated होंगे, it is either anticholinergic poisoning, atropine poisoning, belladonna poisoning है, otherwise the patient is in coma or patient is dead. So we don't have the dilated pupil generally. So dilated pupil you will see in atropine poisoning or anticholinergic poisoning or the Datura poisoning. You can have the dilated pupil in cocaine toxicity. So even in the cocaine toxicity, you will have the dilated pupil. So cocaine toxicity, atropine toxicity, or if the patient is in coma or the patient is already dead. So these are the various conditions where you have the dilated pupil. But in opioid poisoning, you will have the meiosis. In opioid poisoning, you will have the meiosis. So meiosis is a presentation of opioid poisoning. So this is what you people have to be careful. Although the question was easy, but you people have made a mistake. So be careful next time. Read the question carefully. Now we have a next question. Question number, okay, one thing I forgot to mention. What is the antidote of choice? What is the antidote of choice for belladonna poisoning, datura poisoning? Datura poisoning का antidote of choice बताओ. What is the name of the antidote of choice for Datura poisoning? What is the antidote of choice for Datura poisoning? Anyone can answer this question? Like for the organophosphate poisoning, you people have answered atropine, right? Now, what is the best medicine for atropine poisoning now? Atropine का drug of choice क्या है? What is the best medicine for atropine poisoning as an antidote of choice? Yes, the answer is physostigmine. So physostigmine is the antidote of choice. So for atropine poisoning, the antidote of choice is physostigmine, right? So physostigmine is the antidote of choice for Datura poisoning. Now, who will tell me what is the drug of choice for myasthenia gravis? Who will tell me the name of a drug which is the drug of choice for myasthenia gravis? What is the name of the medicine which is the best medicine for myasthenia gravis? I'll give you one hint. The medicine name resembles this name of physostigmine. So what is the drug of choice for myasthenia gravis? Myasthenia gravis ka what is the drug of choice? So drug of choice for myasthenia gravis is, so physostigmine is antidote of atropine poisoning, datura poisoning. But what is the drug of choice for myasthenia gravis? It is a pyridostigmine. So pyridostigmine, during the class, we people have made a mnemonic, the pyari dosti. So it's a pyari dosti, and if you really want to make dost in your life, you have to take the pyridostigmine. So pyridostigmine is the best medicine for myasthenia gravis. And for physostigmine, we made a mnemonic. It is having a word susti in its name. So susti means it's a CNS depressive drug. So it's a CNS depressive medicine. So physostigmine will inhibit the CNS. It will act on CNS. Pyridostigmine will act in periphery. This medicine is given for myasthenia gravis. Now moving on to next question. A 75-year-old female presented with urinary incontinence. Right. So she has come to you with urinary incontinence and she also has the problem of dementia. Now which medicine is given to treat the urinary incontinence? What is the answer of this question, guys? What is the answer of this question? So urinary incontinence, patient को urinary incontinence है, patient is also having a dementia. So which medicine out of these you can try? So what is the answer of this MCQ? Yes, Dr. Satyam Roy, myasthenia gravis में pyridostigmine given along with atropine. Pyridostigmine is given along with atropine. So pyridostigmine is a drug of choice in myasthenia gravis. Atropine is added. Yes, इस MCQ में this question is based on urinary problem. So here the problem is of bladder. Here the problem is of bladder. So you have to find out which medicine will act on bladder. So answer is tolterodine. So tolterodine is a medicine that will act on a bladder. So during our class, we discussed there are 4 or 5 medicines that will act on bladder. One is trospium. So trospium is one drug. The other medicines are derifenacin, solifenacin. So medicines are derifenacin, solifenacin. One more drug is tolterodine, and the last medicine is oxybutynine. So these are the 5 medicines which will act on bladder. So these are the medicines which will typically act on bladder. So we call them the bladder drugs, right? So these medicines typically act on bladder medicine, right? Now, trospium is the only drug here that does not cross the blood-brain barrier. So that does not cross the blood-brain barrier, and because this does not cross the blood-brain barrier, this medicine has no CNS side effect. This is the only medicine that will not lead to CNS side effect. So trospium is the most preferred medicine, followed by the derifenacin, solifenacin. Then we have the tolterodine and the oxybutynine as a drug. So here we have the only one option. Here we have only one option, tolterodine given to you, and that is answer. Now all these medicines are overall the second group of choice. They are overall the second group of choice. But if the question comes to you, what is the overall drug of choice for this condition? The overall drug of choice for this condition is mirabegron. So mirabegron is a drug which will act on beta 3 receptor. Mirabegron is a medicine that will act on beta 3 receptor, right? So mirabegron is a medicine that will act on beta 3 receptor. So that's the best medicine. But in case in this MCQ, because mirabegron is not given, you will mark the trospium as the best medicine. So trospium is marked as the best medicine here because it will not cross the blood-brain barrier. But in this MCQ, we don't have the availability of mirabegron. We also don't have the availability of trospium. We also don't have the availability of derifenacin, solifenacin. So we have moved on to the tolterodine as a best answer. So difficult question, not a easy question, and obviously these kind of questions are generally not asked in your exam. They're just a sample given to you to just to get you an exposure of difficult things, right? So here the tolterodine is the best answer to be marked because this is the only medicine that will act on the bladder here, right? So that will be the answer. Now moving on to the next question. A patient has come to the casualty with organophosphate poisoning. Now he was started with atropine and pralidoxime. He was started on atropine and pralidoxime. Now patient has got sudden rise in temperature. So after 2 hours, patient has got a sudden rise in temperature. Now who will tell me what is the reason for that? What is the reason why the patient has got hypothermia? So organophosphate poisoning, patient has come to you and you have given atropine with pralidoxime combination. We have discussed that atropine plus pralidoxime is the best combination. But after 2 hours, patient has got a sudden rise in temperature. What is the reason for that? What is the reason why the patient has got sudden rise in uh, fever? Yes, the answer is atropine toxicity. So I told you we have to start with the high dose. We have to start with the high dose and we have to reduce the dose after some time. We have to reduce the dose of the medicine after some time. So who will tell me what is the criteria? Who will tell me what is the criteria? What is the criteria when we have to reduce the dose of atropine? So we start with the high dose of atropine and gradually we have to reduce the dose. Yes, the answer is A only. So what is the criteria after which we have to reduce the dose of atropine in patients of OP poisoning treatment? So OP poisoning treatment mein, what is the criteria to reduce the dose of atropine? What are the two important criteria when you reduce the dose of atropine? So the answer is yes, Dr. Ranjan Sahni has marked its dryness. So dryness of eyes, dryness of secretions is the best criteria, followed by what? There is one more. One is a dryness, one is a chest when the chest is bilaterally clear. Yes, chest is bilaterally clear. So dryness and when the chest is bilaterally clear, these two are important criteria. So these are the two criteria that we look for. When these two criteria are satisfied, we have to reduce the dose. Heart rate and other things you will not check. So heart rate ho gaya, pupil ka size ho gaya, those things are not checked. The two important criteria you people have to remember. Two important criteria you people have to remember. One is the one is this what we call it dryness of secretion. The second is the uh, chest should be bilaterally clear. The other signs are not important. Now we have a they are asking the dose of the epinephrine for anaphylactic shock. So we know that epinephrine is a drug of choice for anaphylactic shock, and epinephrine is also drug of choice for cardiac arrest. So we discussed in the above MCQ also, this is the best medicine for cardiac arrest, also the best medicine for anaphylactic shock. Now, who will tell me what is the concentration of this medicine? What is the concentration of the medicine for anaphylactic shock? What is the concentration for cardiac arrest? What is the dose of the medicine? What is the volume of the medicine? And what is the route of administration of these medicines for these two type of conditions? Yes, so here the answer is B, Bombay. So you can see in anaphylactic shock, we use the concentration 1 is to 1000, right? The dose, the volume is 0.5 ml. Okay, that's fine. And the route of administration is IM route. Now, who will tell me what is the dose? 0.5 ml is the volume. Then you people have to answer me what is the dose of the medicine and what is these things applicable to cardiac arrest. Cardiac arrest mein, what is the concentration? What is the concentration? What is the dose? What is the volume? What is the route? Who will answer me these questions? Like इनमें से कौन सा डोज कार्डियक अरेस्ट का है? Yes, Dr. Prachi has given the correct answer. In cardiac arrest, we use 1 is to 10,000, right? So in 1 is to 10,000, the volume is 10 ml. The route is IV route. In case the IV route is not there, intraosseous route is also there. So 10 ml IV route, intraosseous route. Yes. So here the dose is 0.5 mg and here the dose is 1 mg. So here the dose is double, it's 1 mg. So this is what you people have to remember for the anaphylactic shock and the cardiac arrest. Now recently for anaphylactic shock, the epinephrine can be given in the form of nasal spray also. So recently the nasal spray, 2 milligram nasal spray is also available for the treatment of anaphylactic shock. So nowadays the 2 milligram nasal spray also available for the treatment of cardiac arrest. Sorry, for the anaphylactic shock. Okay, next, let's move on to the next question. A chronic smoker on the nicotine replacement therapy. The patient is on nicotine replacement therapy and also take the clonidine tablets. So clonidine is one of the drug that we use for nicotine de-addiction. So patient who was a smoker, patient is on nicotine replacement therapy and also taking clonidine for de-addiction. Now he suddenly stopped taking the clonidine tablet. He has stopped taking the clonidine tablet and now got a headache. Now what is the reason for this headache? Why the patient has got headache? Any idea? So patient was taking nicotine, patient was taking clonidine. Now he was stopped the clonidine. Now he has got a headache. What is the reason for the headache? Yes, the reason for the headache is, what is the reason? So the patient has got a rebound hypertension crisis. So patient has got a rebound hypertension crisis. So patient has got a rebound hypertension crisis. We also call it clonidine withdrawal syndrome. So patient has got a rebound hypertension crisis. We call it a clonidine withdrawal syndrome. So clonidine withdrawal syndrome, patient will develop a rebound hypertension crisis, right? And you people have to answer me, what is the drug of choice? What is the drug of choice for clonidine withdrawal syndrome? Like how we can treat the clonidine withdrawal syndrome? What is the best medicine to control the clonidine withdrawal syndrome? Best medicine to control the clonidine withdrawal syndrome. What is the name of the drug? The name of the medicine is, so this is a rebound hypertension crisis. We also call it clonidine withdrawal syndrome. What is the best medicine for this? What is the best medicine for clonidine withdrawal syndrome? Can any one of you mark the answer? So the answer is phentolamine. So there is a drug phentolamine. Phentolamine is a medicine. This is the best medicine for clonidine withdrawal syndrome. This is the best medicine for clonidine withdrawal syndrome. So best medicine for clonidine withdrawal syndrome is phentolamine. And phentolamine is a drug of choice for three conditions. So during the class, we made a mnemonic that phentolamine is a Fenta should be taken with cheese and the clove. So in case you remember these mnemonics we have made during the class, that the Fenta should be taken with cheese and the clove. So phentolamine is also the best medicine for cheese reaction. This is the best medicine for clonidine withdrawal syndrome. And this is the best medicine for vasoconstriction caused by epinephrine. So this medicine has three important indication. Phentolamine that we made a mnemonic during the class. The Fenta should be taken with cheese and the clove. So phentolamine, which is an alpha blocker, this is the best medicine for cheese reaction, clonidine withdrawal syndrome, as well as the best medicine for vasoconstriction caused by the epinephrine, as well as best medicine for the vasoconstriction caused by the epinephrine. Now here I would like to ask you one more question. Clonidine is also used as antihypertensive drug. Clonidine is also used as antihypertensive drug. What is the mechanism of action? I want to know clonidine acts on which receptor? Clonidine acts on which receptor and can treat the hypertension? So clonidine acts on which receptor and control the hypertension? Can any one of you tell me? What is the mechanism of action of clonidine? Clonidine कौन से receptor पर act करता है? Clonidine acts on which receptor and control the BP? Anyone would like to answer? Clonidine is not a calcium channel blocker, Dr. Hinata. Clonidine is something else. So calcium channel blockers end with the word dipin. This is deen. ये डीन है, वो डिपिन होते हैं, डिपिन. Yes. So Dr. Megha, Dr. Suvo, Dr. Prachi has given the correct answer that clonidine will act on alpha 2 receptor. So clonidine acts on alpha 2 receptor used as antihypertensive. Medicine, if you stop it suddenly, can cause rebound hypertension crisis. Phentolamine is the best medicine for the treatment of this condition. You can easily imagine if phentolamine is alpha blocker, so the medicine phentolamine is an alpha blocker. It's the best medicine for clonidine problem. So clonidine should be the alpha agonist only. So clonidine acts on alpha receptor. Phentolamine block the alpha receptor. It's the best medicine for clonidine withdrawal syndrome. It's very easy to correlate, right? Okay, let's move on to the next question. The elderly female has got wrinkles on her face. So she has got wrinkles on her face and she has taken a Botox for that. The elderly female has got wrinkles and she has taken a Botox for that. What is the mechanism of action? What is the mechanism of action of Botox? So anyone can answer. What is the mechanism of action of Botox? So Botox acts by which mechanism? What is the mechanism of action of Botox in treatment of wrinkles? Yes, so this is inhibitor of release of acetylcholine. So Botox is the medicine. This is inhibitor of release of acetylcholine. And can any one of you tell me how exactly this medicine can inhibit the release? What is the name of a protein that is inhibited by Botox? Botox inhibit which protein? Yes, so Dr. Suvo has given the answer. This medicine is SNAP25 inhibitor, and by inhibiting the SNAP25, this will stop the release of acetylcholine. Now here I want to know this medicine is which type of SNAP25 inhibitor? Is it a reversible inhibitor or irreversible inhibitor? Botox is reversible inhibitor of SNAP25 or the irreversible inhibitor? Yes, SNAP25 is a type of snare protein. So Dr. Vinayak, your answer is also correct. It's a type of a snare protein. Yes, it's a type of a snare protein. And it is a which type of blocker? Is it a reversible blocker or the irreversible blocker? Is it a reversible or the irreversible blocker? The answer is irreversible. So Dr. Masoom has given the correct answer. It's an irreversible inhibitor of this receptor, and that's why the medicine action lasts for uh, many days. Medicine action lasts for many weeks. So this is a SNAP25 inhibitor. Now let's move on to the next question. A 62-year-old male complains of weak urinary stream and the frequent urination. So weak urinary stream and frequent urination, you must be knowing the patient is a case of BPH. So this patient is a case of benign prostate hypertrophy, having a frequent urination and the weak urinary stream. He also mentioned that he also feels the lightheadedness and having a low BP. So which drug is preferred to be given to this patient? Yes, the answer is tamsulosin. So tamsulosin is the drug of choice for this condition that we already know. So tamsulosin is the best medicine to be given. It's the best medicine for BPH. And here you people have to tell me two things. What is the mechanism of action of tamsulosin and what are the side effects of tamsulosin? So during the class, we people have made many mnemonics for that. So tamsulosin inhibit which receptor? First MCQ, first question. It inhibits which receptor? The second question. Okay, this is inhibitor of alpha 1, but I want to be very specific. Like I want to know the specific name of the receptor. It is blocker of alpha 1 or something else? Yes, it is blocker of alpha 1, but which subunit of alpha 1? Yes, so Dr. Ranjan Sahni has given the correct answer. It is Dr. Suvo has given the correct answer. It's an alpha 1A blocker. This is a medicine which is a selective alpha 1A blocker. So this medicine is a selective alpha 1A blocker. And what are the side effects of tamsulosin? What are the side effects of tamsulosin? Can any one of you answer? Very good. So Dr. Suvo has made a mnemonic that we discussed during the class also. Dr. Prale, this will not cause hypotension. This will not cause hypotension. This is the main advantage of using the medicine. So don't get confused in these things. Other drugs, other alpha blockers can cause hypotension. Other drugs can cause hypotension, but this will not cause hypotension. What are the side effects of this medicine? So we have made a mnemonic during the class, FIRE. The FIRE full form is floppy iris syndrome and retrograde ejaculation. So this medicine can cause floppy iris syndrome and the retrograde ejaculation. So floppy iris syndrome, retrograde ejaculation, the side effect of this medicine, tamsulosin. And also I can see the many of you have mentioned the second drug of choice. The second drug of choice for BPH is 5-alpha reductase inhibitor. So 5-alpha reductase inhibitors are the second drug of choice for BPH. 5-alpha reductase inhibitors, all the medicines end with the word ride. So all medicines end with the word ride, 5-alpha reductase inhibitor. So these medicines are second drug of choice for BPH. This is what we people have covered. So our answer of this question is tamsulosin. Can you give me the examples of 5-alpha reductase inhibitor? Can you give me some examples of 5-alpha reductase inhibitor? Some examples of 5-alpha reductase inhibitor, if you can give me. Yes, one example Dr. Abrar has given finasteride. So one example is finasteride. So please remember guys, RIDE is for reductase. The medicine's name ends with the word RIDE, reductase inhibitor. Okay, let's move on to the next question. A 45-year-old man diagnosed with type 2 diabetes mellitus. So 45-year-old diagnosed with type 2 diabetes and he is on propranolol. He is on propranolol treatment for essential tremor. Now, you will not prefer to use propranolol in this patient. What is the reason? What is the reason why you don't prefer propranolol in this patient? So, who will tell me propranolol belongs to which generation of beta blocker? You people have to mention this belongs to which generation of beta blocker and what are the three important side effects of that generation? Yes, the answer is C only. It will mask the hypoglycemia. It will cause hypoglycemia. It will mask the hypoglycemia. So this belongs to which generation? This medicine belongs to which generation? Propranolol belongs to which generation, guys? Anyone would like to answer? Propranolol belongs to generation 1, 2 or 3. Anyone? Yes, this belongs to generation 1. So propranolol belongs to generation 1. And what are the three important side effects of generation 1 beta blocker? Can any one of you tell me? What are the three important side effects of generation 1? What are the three important side effects of generation 1 beta blocker? So generation 1 beta blockers can lead to three important problems. What are those three problems? Can any one of you tell me? What are the three important side effects of generation 1 beta blocker? So guys, please remember generation 1 beta blockers have three big drawbacks. These medicines can cause bronchospasm. I told you this is very, very important. So Dr. Suvo is answering well. So bronchospasm is a one important side effect. So this will cause, yes, bronchospasm. The second is vasospasm. The third is hypoglycemia. So three problems this medicines can cause. So any medicine which is generation 1, any medicine which is generation 1 can cause bronchospasm, vasospasm, hypoglycemia. So these are the three important side effects of generation 1 beta blocker. So propranolol belong to this class. So these are the three important side effects. This question is very important for exam. Now moving on to the last question of autonomic nervous system. One elderly man got a diabetic nephropathy. One elderly man got a diabetic nephropathy. Now he has presented in emergency with palpitation and the chest discomfort. ECG has shown the tall T wave. So tall T wave means the patient has got a hyperkalemia. So tall T wave means the patient has got a hyperkalemia. Okay, they have given already. He has got a elevated potassium level. So which medicine is given for the treatment of hyperkalemia? So this question is difficult. So please remember epinephrine. It is one of the rare indication. It is one of the rare indication of epinephrine. So what are the indications of epinephrine? So there are two indications of epinephrine we people have already covered. There are two indications of epinephrine we people have already covered. Now please remember Okay, according to you, answer is glucagon. No, glucagon is not given for hyperkalemia. Glucagon is not given. This is a rare indication. So, guys, let me tell you. Uh, One is epinephrine. One drug is epinephrine. The other drug is salbutamol. So we have the drug like epinephrine, salbutamol, and we have a drug insulin. So epinephrine, salbutamol, and insulin. These medicines can stimulate one pump in the body. We call it a sodium potassium ATPase pump. And by stimulating sodium potassium ATPase pump on our muscles, they can shift all the potassium. They can shift all the potassium into the cell. So they can shift all the potassium into the cell. So these are the three medicines which are given for hyperkalemia. The medicines are epinephrine, salbutamol, insulin. All the three medicines act by the same mechanism. They will stimulate sodium potassium ATPase on the muscles and shift the potassium into the cell. So epinephrine is the answer of this question. So this is one of the rare indication of epinephrine. Now here you people have to tell me what is the drug of choice for hyperkalemia. Who will tell me what is the drug of choice for hyperkalemia? So hyperkalemia ka drug of choice is calcium gluconate. So calcium gluconate is the best medicine for hyperkalemia, but we don't give calcium gluconate alone. We give calcium gluconate always with insulin. So calcium gluconate is always given with insulin. So calcium gluconate is given to stabilize the patient ECG. So calcium gluconate is given to stabilize the patient ECG, and the insulin is the one that will shift all the potassium inside. So this is the best treatment for hyperkalemia. So here the answer is epinephrine. No, glucagon as such is not useful. Dr. Ranjan Sahni, we have to understand Kemena, calcium is required. Calcium is the one when I give to the patient, this will stabilize the cardiac membrane. So this will stabilize the cardiac membrane. So calcium will stabilize the cardiac membrane. So calcium will stabilize the cardiac membrane and can prevent the ECG complication. So this will prevent the ECG complication, can prevent the ECG complication. So calcium is required. Plain glucagon will not solve the purpose. So the best treatment for hyperkalemia is calcium. The calcium is more important thing that is given. Now moving on to the respiratory system. Respiratory system, you people know the treatment of bronchial asthma is very important. So what is the treatment of choice for bronchial asthma? Whenever patient has got a bronchial asthma, what is the best treatment to be used? So patient has got breathlessness, patient has got wheezing, and they are asking the treatment. What is the best treatment for bronchial asthma? So the best treatment of bronchial asthma is we give a combination of inhaled corticosteroid and the LABA. So long-acting beta-2 agonist, we will give the combination of inhaled corticosteroid with the LABA. So this combination is combination of choice. So the most commonly used steroid is budesonide. Most commonly used steroid is budesonide, and the most commonly used bronchodilator or the LABA is formoterol. So most commonly used medicine is formoterol, and most commonly used steroid is budesonide. So budesonide is most commonly used steroid, and formoterol is most commonly used LABA. So here the best answer is steroid plus LABA combination. So steroid plus LABA combination, C is the answer of this MCQ. You people have to understand inhaled SABA is salbutamol. So salbutamol ko we do not use, right? So we do not use for maintenance treatment because salbutamol has problem. यहाँ पे tolerance हो जाता है. So tolerance is easy to develop. So salbutamol we don't use for maintenance treatment. Otherwise the tolerance will develop, right? So salbutamol is not the answer. We give the medicine like lava. So who will tell me? Here you people have to give me some answers. My first question: if the patient condition will worsen, if the patient condition will worsen even after starting the above treatment, like you have started the above treatment, still the patient condition will worsen. So which medicine dose need to be increased? Will you increase the dose of steroid or you increase the dose of formoterol? My question is, you have started with budesonide plus formoterol. Now, my next question, if the disease is still worsening, even after starting this combination, even after starting this combination, if the disease will worsen, then you will increase the dose of budesonide or formoterol. Yes, so every time we increase the dose of steroids. So every time you have to increase the dose of steroid, and if the patient condition improves, you decrease the dose of steroid. So every time you increase the dose of steroid or decrease the dose of steroid whenever it is required. But formoterol we keep constant. So formoterol ka dose remain constant, but budesonide ka dose we can increase or decrease as per the requirement. Okay. So these are the things that you people have to keep in mind. Now I would like to know one more thing from you. Who will tell me what are the examples of LABA? LABA का example क्या है? One example is formoterol. So can you please tell me the other example which is a LABA? So LABA means long-acting beta-2 agonist. So long-acting beta-2 agonist. One example is formoterol. What is the other example of the drug which is a LABA? I want to know the other example of the medicine which is a LABA. Any other drug which is a long-acting beta-2 agonist, you know? I'll give you one hint. The medicine is having a word metro in its name. Medicine is having a word metro in its name. So any other drug you know that is a long-acting beta-2 agonist. So that is a formoterol. The other drug, like I can see, Dr. Ajay Vijayan. Ajay Vijayan has given the correct answer. Mohan Bhopale also has given the correct answer. It's salmeterol. So salmeterol, formoterol are the medicines. These medicines are the long-acting beta-2 agonist. Now I would like to know the medicine which is SABA. The SABA is salbutamol. Now the salbutamol is a drug of choice for acute bronchial asthma. This is the drug of choice for acute bronchial asthma as well as acute COPD. Salbutamol is the best medicine for acute bronchial asthma and COPD, the fastest acting medicine. Now, who will tell me the side effects of salbutamol? So, what are the side effects of salbutamol that we discussed during the class? Who will tell me the important 6 side effects of salbutamol? What are the 6 important side effects of salbutamol that we have discussed during the class? Right? So, what are the 6 important side effects of salbutamol that we discussed during the class? Anyone would like to answer? कि salbutamol के side effects क्या क्या है? So salbutamol side effects, yes, we discussed during our class. The mnemonic is 3T3H. So we made a mnemonic during the class 3T3H. Yes, so I can see Masoom has given the correct answer 3T3H. Yes, Dr. Murugan has said कि tachycardia, correct answer. Dr. Sahani, yes, it's 3T3H. No, Dr. Siddiqui, your answer is wrong. So please be careful. I'm asking the side effects of salbutamol, not of the steroid. Steroid में होगा oral thrush. Steroids will cause oral thrush, but salbutamol will cause tachycardia, tremors, tolerance, hyperglycemia, hypotension. All these side effects can be hypokalemia. So all these things can be seen with salbutamol as a side effect. Now next question is, a child was started on cyclesonide inhalational therapy. So cyclesonide is again a inhalational corticosteroid. Cyclesonide is again a inhalational corticosteroid. Now which statement is correct about the cyclesonide? Now guys, please remember cyclesonide is a drug. There was a clinical trial. There was a clinical trial that was done where the cyclesonide was given in inactive form. So cyclesonide is the only inhalational corticosteroid. Cyclesonide is the only inhalational corticosteroid that can be given in inactive form. And when I give this medicine in inactive form, we have observed that medicine ke side effects are less. Medicine side effects are less, and that's why we say that this steroid has no hard feeling for human being. So this steroid has no hard feeling for human being. So this steroid has a soft feeling for human being. So this is known as soft steroid. So cyclesonide is a medicine which is known as soft steroid because during this clinical trial, the medicine was used in inactive form, and because of the inactive form, we observed that number of side effects are less. Number of side effects are less. So we say that this steroid has a soft feeling for us. So we call it a soft steroid. The medicine is cyclesonide, but this clinical trial was a failure. This clinical trial was a failure. Later on, we found that side effects are same. Later on, we found that koi difference nahi hai. This was a fake trial. So, but the name is still famous, the soft steroid. So, if you read the statement, cyclesonide can lead to fewer side effects compared to the other steroid. Yes. So as per the clinical trial, this is yes. Now, it is a prodrug. It is given in inactive form, activated by bronchial. Yes, this is also true. Now, the occurrence of oral candidiasis is more. Now this is false. So this is a false statement. The oral candidiasis is less with this medicine as per the clinical trial. Practically नहीं होता guys. That's why this question is unimportant. This question is unimportant. Practically this does not happen. And the fourth is oral bioavailability is negligible. Yes, like you are giving the medicines by inhalational route, it will not go to the plasma. So the C is the most correct answer over here. Like this is a incorrect statement out of these four. So this is the most appropriate answer of this MCQ. I hope you have understood the concept. Now come to the main important question. So this question everybody should answer without any mistake. So can any one of you tell me, a patient of bronchial asthma is on inhalational corticosteroids, presented with white patchy lesion on the tongue and the buccal mucosa, which is the drug that we can use for the treatment of this condition. So this is the most common side effect of steroid. This is the most common side effect of inhalational corticosteroids. So most common side effect of inhalational corticosteroid is oral candidiasis. So patient has come to you with oral candidiasis. Patient has come to you with oral candidiasis, oral thrush. How will you treat this patient of oral thrush? What is the answer? Yes. So we treat this patient with local antifungal. We treat this patient with local antifungal, and the local antifungal of choice is clotrimazole. So the local antifungal drug is clotrimazole. If it is not given, go for nystatin. So clotrimazole and the nystatin are the medicines. Clotrimazole and the nystatin are the medicines that are the local antifungal. But if the local antifungal are not able to control, we have to give the systemic antifungal drug. We have to give the systemic antifungal drug, and the systemic antifungal of choice is fluconazole. So fluconazole is a systemic antifungal of choice. Fluconazole is a systemic antifungal of choice. So clotrimazole is the best answer to be marked. So clotrimazole is the best answer. This is very, very important MCQ for your exam. So be careful. This question can be asked in your exam again. So clotrimazole is a medicine that we can use as a local antifungal, and oral fluconazole is the overall the best medicine. Overall best medicine fluconazole hai, but that is given by the oral route. So this medicine is given by the oral route, but we start with local antifungal like the clotrimazole. Okay, so for this question, the answer is A. Next is a male patient suffering from COPD was given theophylline, right? Now, this medicine can result in increased urine output. So, what is the receptor involved here? So, guys, do you remember we discussed that theophylline is a drug that we get from tea and coffee, and during our class we made a mnemonic of tea also. We made a mnemonic of tea. So who will tell me what are the two mechanism of action of theophylline? What are the two mechanism of action of theophylline? So we made a mnemonic that T stands for theophylline. So T is for theophylline. The origin of medicine is from T. T is for theophylline. And who will tell me the two mechanism of action of this medicine? What are the two mechanism of action of theophylline? Anyone? What is the mechanism of action of theophylline? My question is, what is the mechanism of action? The answer of this MCQ is adenosine. So theophylline is a medicine, that is T is for theophylline. Yes, so Dr. Megha has said this medicine is an enzyme inhibitor, and this medicine is also adenosine A1 receptor inhibitor. So this is the medicine which is adenosine A1 receptor inhibitor, and this is a phosphodiesterase enzyme inhibitor. So this is the drug which is phosphodiesterase enzyme inhibitor, as well as this medicine is adenosine A1 receptor inhibitor. So these are the two mechanism of action. This is enzyme inhibitor and adenosine A1 receptor inhibitor. Now, what are the side effects of this medicine? The side effects of this medicine is same as tea and coffee. So whenever we take high dose of tea and coffee, we will have the insomnia. So we can have the insomnia, we can have the diuresis, we can have the tachycardia, we can have the nausea, vomiting. So this medicine will cause same side effect like a tea and coffee can cause. So just like a tea and coffee, this medicine can cause insomnia, diuresis. जब हम tea and coffee लेते हैं तो क्या होता है? We cannot sleep. So insomnia, diuresis, tachycardia, nausea, vomiting, and all side effects are due to adenosine receptor. All side effects are due to adenosine receptor. So whatever side effect of theophylline they will give you, every time you mark the answer as adenosine A1. So adenosine A1 is the main, yes. So like Dr. Sahni has mentioned कि seizure भी करते हैं, yes, they can cause insomnia, they can cause seizures, diuresis, and tachycardia, tachypnea, nausea, vomiting. All these things can be seen, and all these side effects are due to this adenosine A1 receptor. So all these side effects are due to this adenosine A1 receptor. So answer is C. So C is the answer you will mark over here. So they are asking if patient has got a diuresis. What is the reason for that? Answer is adenosine A1. Now let's move on to the next question. That's a kidney. So kidney के questions में the first question is a hypertensive patient comes to you with CKD. Hypertensive patient comes to you with CKD and patient has got a frequent attacks of renal colic. So patient has got a renal stone. So patient has got a hypertension with renal stone. So hypertension with renal stone, which medicine is used? Patient को hypertension है and patient is also having a kidney stone. So can any one of you tell me which medicine can be used for this? Which medicine can be used for this? Yes, the answer is hydrochlorothiazide. So you people have to understand there are two diuretics. One is loop diuretics. One is known as loop diuretic. One is known as thiazide diuretic. So we made a mnemonic during the class that loop diuretics will lose calcium and thiazide diuretics will retain calcium. So thiazide diuretics retain calcium, loop diuretics lose calcium. So whenever you have the extra calcium in kidney, thiazide diuretics will take away that calcium from kidney and shift it into the plasma. So whenever you have the extra calcium in kidney, that is taken up by the thiazide and shift it into plasma. So this will take care of the kidney stone also. So the best answer is thiazide. Hydrochlorothiazide is the best answer to be marked. Right? Now here you people have to tell me few questions. Who will tell me the site of action? What is the site of action of thiazides? Where does the thiazides will act? What is the mechanism of action of thiazide? What is the site of action? What is the site of action of thiazides? What is the mechanism of action of thiazides? What is the site of action? What is the mechanism of action? Anyone can answer? Thiazides ka, what is the site of action? What is the mechanism of action? Okay, yes. So thiazides will act on early part of DCT. Thiazides will act on early part of DCT. So yes, they will act on early part of DCT. And what is the mechanism of action? What is the mechanism of action? In early DCT, how these medicines will act in the body? What is the mechanism of action? Yes, so they are the inhibitor of sodium chloride channel. So they are the inhibitor of sodium chloride channel. So the site of action, early DCT, mechanism of action, they are the sodium chloride channel inhibitor. Now, one indication of thiazide is hypertension. Can any one of you tell me any other indication of thiazides? So one of the indication of thiazide is hypertension. The other indication is kidney stone. Any other indication of thiazide you know? Any other indication of thiazide you people know? Okay, so that will lead to calcium reabsorption that we have already covered. It is given for renal stone. Second indication, it is given for hypertension. Any other indication? There is one very important indication. I'll tell you, this is the medicine that we use for, yes, diabetes insipidus. So this is the medicine that will retain the water, and with retention of water, this medicine is given for diabetes insipidus also. Very good. So this is given for diabetes insipidus also. So this medicine is given for diabetes insipidus. So question number, so this question answer is hydrochlorothiazide. Now let's move on to the next question. A female suffered from head injury in road traffic accident. On examination, she has got a raised ICT. So she has got a raised ICT. And for this raised ICT, which drug is best medicine to be started? So what is the best medicine to be started here? Nikita, thiazides are not given for edema. You have to understand that thiazides can cause water retention. And because thiazides will cause water retention, they will not given for edema. So yes, the answer is mannitol. So mannitol is the best medicine for raised ICT. Mannitol is the best medicine for raised ICT. So during the class, we people have made this type of diagram. If you remember, we people have made this type of diagram, and we have discussed the various types of condition, like if the patient has got a cerebral edema. So who will tell me what is the drug of choice for cerebral edema? Now, if a patient has got a periorbital edema, what is the drug of choice for periorbital edema? What is the best medicine for congestive heart failure with pulmonary edema? Congestive heart failure with pulmonary edema. Which is the best medicine for ascites that is seen in liver cirrhosis? So in patients of cirrhosis, you will see the ascites, which is the best medicine to be given. Which is the best medicine for pedal edema? Which is the best medicine for pedal edema? All these things we have covered. And we also covered which is the best medicine for raised ICT and which is the best medicine for raised intraocular pressure. So we discussed during the class कि cerebral edema में we give mannitol. Cerebral edema में we can give mannitol. Periorbital edema में the best medicine is furosemide. That's a loop diuretic. CHF with pulmonary edema, again furosemide is a drug of choice. Right? CHF में furosemide के बाद SGLT2 inhibitors are wonderful drugs. We also use SGLT2 inhibitors for CHF patient. Now ascites में who will tell me the best medicine for ascites? Yes, Dr. Vijayan has given the correct answer. Ascites का best medicine is spironolactone. Spironolactone is the best medicine for ascites. And for pedal edema, the best medicine is again furosemide. Now for raised intraocular pressure, we give acetazolamide. For raised intraocular pressure, we give acetazolamide. And for the raised ICT, we again give the mannitol. So mannitol for raised ICT and acetazolamide for raised intraocular pressure. So this is what we people have discussed, the drug of choice for the various types of edema during the class. So in case you people have any doubt, you can ask anytime. So all these edemas we have covered during the class, right? So this is all about this MCQ. Moving on to the next question. A 50-year-old man rushed to the emergency department in impaired consciousness following a hunger strike for a day. So patient was on hunger strike and he got unconscious, brought to the emergency department. Wife reported he has got a head injury 1 month back. 1 month back head injury tha, and now he is getting the complaints of polyuria. Right? Now because of the polyuria, he is passing the urine. Now he is dehydrated because of that reason. Or MRI में you can see some lesion in the pituitary gland. What is this condition? First of all, ये क्या condition है? What is this condition? Why he is getting a polyuria? What is this condition? Why he is getting a polyuria? Polyuria means what, guys? Polyuria means he is getting a diabetes insipidus. So he is suffering from diabetes insipidus, and as a result of diabetes insipidus, he is dehydrated. He is losing the water. He is dehydrated. Now the problem lies in CNS. Yes, this is a case of central diabetes insipidus. This is a case of central diabetes insipidus. And what is the drug of choice for central diabetes insipidus? Drug of choice for central diabetes insipidus is desmopressin. So desmopressin is the medicine which is the best medicine for central diabetes insipidus. And who will tell me desmopressin acts on which receptor? Desmopressin acts on which receptor? Will it act on V1 receptor or V2 receptor? Will it act on V1 receptor or V2 receptor? So desmopressin acts on V2 receptor. And for nephrogenic diabetes insipidus, thiazides are the drug of choice. So thiazides are drug of choice for nephrogenic diabetes insipidus, and desmopressin is drug of choice for central diabetes insipidus. Okay, now who will tell me? देखो, central diabetes insipidus में patient will have the anti-diuretic hormone deficiency. Patient will have the ADH deficiency. But if I discuss the opposite of diabetes insipidus, that is known as SIADH. So SIDH is the condition where the ADH secretion is very high. Where the ADH secretion is very high. And because the ADH secretion is very high, what is the drug of choice? What is the drug of choice for SIADH? Can any one of you mark the answer? So ADH का drug of choice, SIDH का drug of choice क्या है? So central diabetes insipidus, ADH का deficiency है. Desmopressin is the best medicine to be given. But what is the best medicine for SIADH, where the ADH level is high? Yes, so we have a drug. The drug name is tolvaptan. So tolvaptan is a medicine that ends with the word vasopressin antagonist. You can see the medicine name is tolvaptan. So medicine ends with the word AN. So AN means the antagonist, and before the word antagonist, you can see the name vasopressin. So this medicine is vasopressin antagonist. Yes, so tolvaptan is best medicine for the treatment of SIEDH. Now moving on to the next question. A 30-year-old man joins a pilgrimage at the Shirin, and he has got a uh, he went to the mountain peak. Now at mountain peak he has got a chest tightness, breathlessness, altered sensorium. So which of the following drug can be given for symptomatic relief? So can you please diagnose the condition? So this is the condition of acute mountain sickness. So this is a case of acute mountain sickness. And can any one of you tell me what is the drug of choice for acute mountain sickness? Yes, so the drug of choice is acetazolamide. So for acute mountain sickness, the best medicine is acetazolamide. Now here you people have to tell me what is the site of action, what is the site of action, and what is the mechanism of action. What is the site of action? What is the mechanism of action? So if I tell you the various tubular part, PCT, then we have a loop of Henle descending limb, then we have a loop of Henle ascending limb, then we have the early part of DCT, then we have a late part of DCT. We also have the cortical collecting duct, and the last is medullary collecting duct. So who will tell me which diuretics can act on these parts? Yes. So this is a carbonic anhydrase inhibitor. Acetazolamide is a carbonic anhydrase inhibitor. The site of action is PCT of kidney. So who will tell me which other medicines can act on PCT of kidney? Which other medicines can act on PCT of kidney? What are the other medicines that will act on PCT of kidney? Which medicines will act on descending loop of Henle? Which medicine will act on ascending loop of Henle? Which medicine will act on early DCT? Which medicines will act on late DCT and cortical collecting duct? And which medicines will act on medullary collecting duct? PCT में carbonic anhydrase inhibitors can act. What else? Mannitol. Wonderful answer. So we have the mannitol. So mannitol can also act. So carbonic anhydrase inhibitors, mannitol. Yes, Dr. Sahani has given the correct answer. SGLT2 inhibitors. So SGLT2 inhibitors will also act. Now descending loop of Henle, again you people have to remember that mannitol. So mannitol can act at two location. Mannitol can act at two location. Ascending loop of Henle, loop diuretics can act. Ascending loop of Henle, loop diuretics can act. Early DCT we have already covered. Thiazide diuretics can act. Now here the potassium sparing diuretics. So potassium sparing diuretics will act like spironolactone. So spironolactone will act on late DCT cortical collecting duct. But here the V2 receptor antagonist. V2 receptor antagonist like the tolvaptan. Tolvaptan can also act, and here also the V2 receptor antagonist can act. So you people have to understand that mannitol has a two sites of action. Mannitol has two sites of action, and the V2 receptor antagonist. V2 receptor antagonist also have two sites of action. So V2 receptor antagonist and mannitol, they have the two sites of action. This is what we people have covered. Now let's move on to the cardiovascular system. In cardiovascular system, question number one, a 2-year-old child, 2-year-old child present to the emergency department, present to the emergency department with lethargy, difficulty in feeding and dehydration. The child is not able to eat properly, patient is dehydrated, vitals are stable, बच्चा stable है, ECG is shown below. What is the next step? So this is the ECG they have shown. So can you find out which problem is this? So can you find out this sawtooth appearance? So this is a sawtooth appearance. This is a sawtooth appearance. Sawtooth appearance. So sawtooth appearance means which problem? Sawtooth appearance means which problem? The child has got which problem? The child is having some arrhythmia going on. What is the name of the arrhythmia? Where we have a sawtooth appearance, we call it a atrial fibrillation. The child is getting atrial fibrillation, and atrial fibrillation is a supraventricular type of arrhythmia, And you can see in this case, the ventricle is also getting affected. The ventricle is also getting affected. So atrial fibrillation is a supraventricular type of arrhythmia, right? और इस केस में you can see ventricle में भी changes हो रहे हैं. And when the supraventricular tachycardia is shifting to the ventricle, this is known as paroxysmal phenomena we discussed during the class. So this is the case of PSVT, है ना? तो बच्चे को symptoms आ रहे हैं, it means the cardiac output is affected to some extent, but not severely affected, but this may affect very soon. So this may affect very soon because child is right now stable, but patient very soon become unstable. So you have to stop this conversion of supraventricular tachycardia to the ventricular tachycardia. So you have to put a block at AV node. So you have to put a block at the AV node. So AV node ko you people have to block. So if you block the AV node, then the supraventricular arrhythmia cannot be shifted to the ventricle. So which medicines we can use? The answer is ABCD. So ABCD are the 4 medicines that are given to block the AV node, and these medicines are best medicines for PSVT. So who will tell me what are the 4 medicines that we can use for PSVT? What are the 4 medicines that we can use for PSVT? So which 4 medicines we can use for PSVT? The A stands for adenosine, the B stands for beta blocker, the C stands for calcium channel blocker like verapamil. So adenosine, beta blocker, calcium blocker, and digoxin. So these are the 4 medicines that we can use for this patient of PSVT. And the drug of choice is adenosine. The second drug of choice is verapamil. Second drug of choice is verapamil, calcium channel blocker. So adenosine, beta blocker, calcium channel blocker, and digoxin. These are the 4 medicines that we can use for PSVT. And who will tell me the dose of adenosine? So the dose of adenosine for this condition is, the first dose is 6 milligram, the second dose is 12 milligram. So this is applicable for 60 kg person. This dose is for 60 kg person, 6 milligram, 12 milligram. So when we convert in milligram per kg, the answer will be 0.1 milligram per kg. So the first dose is 0.1 milligram per kg. The second dose of the medicine is 0.2 milligram per kg. So adenosine dose is 0.1 milligram per kg. The second dose is 0.2 milligram per kg of the adenosine that is given for PSVT. Now you people have to tell me the side effect of adenosine. What is the side effect of adenosine and what is the solution of that problem? So what is the side effect of adenosine? What is the solution of that problem? Can any one of you tell me the side effect of adenosine and what is the solution? So side effect of adenosine is bronchospasm. Adenosine can cause bronchospasm, so should not be given in patients of bronchial asthma and COPD. Adenosine cannot be given in patients of bronchial asthma and COPD, can cause bronchospasm. So what is the alternative? The alternative is verapamil. So in case you cannot give adenosine, then verapamil will be the answer. So verapamil will be the answer of your MCQ where you cannot give the adenosine. So if a patient is a case of bronchial asthma COPD, you will mark the verapamil as a best answer. So adenosine mein the problem is bronchospasm. Please remember this drug is important for exam. Medicine side effect is bronchospasm. So if a patient is a case of bronchial asthma, we mark verapamil as a best medicine. So verapamil will be the best medicine to be given. Now I would like to ask the medicine duration of action. So do you have any idea what is the duration of action of adenosine? Adenosine is a long-acting medicine or the short-acting medicine? Can any one of you tell me? So adenosine is blocker of AV node, and this medicine is the best medicine for PSVT. The dose is 6, the other dose is 12, given by IV route, given by IV route, and this medicine can cause bronchospasm as a side effect. The solution is verapamil. Now my next question is this medicine long-acting drug or short-acting medicine? Yes, the medicine is very short-acting medicine. It's a very short-acting medicine. The half-life is only 10 seconds. The half-life is only 10 seconds. So in case you remember this point, it's a shorter acting, it's more than enough. Like in case you cannot remember the exact duration, it's fine. The information that this is very short-acting medicine, it is more than enough. And now my next question, why this drug is shorter acting? Why this adenosine is shorter acting medicine? What is the problem with this medicine? Why this medicine is short acting medicine? What is the problem? The problem is this medicine get metabolized in the blood. So medicine get metabolized in the RBC. Medicine get metabolized in blood. So it's a short acting medicine. The drug name is adenosine. It's a short acting medicine. right? Metabolized by RBC, and this is how we give adenosine to a patient. Now, my next question is, a patient is brought to the emergency with a history of consumption of 8 tablets of digoxin. So 8 tablets of digoxin, it means the digoxin toxicity they are indicating. Now patient has got unstable and the heart rate has become less, heart rate has become 56. So patient has got a bradycardia. So digoxin से bradycardia हो गया and patient has got a heart block. Now what is the next step in the management of this patient? So can you please tell me what is the best treatment for this? What is the best treatment for digoxin toxicity? How we can treat this patient? So in this case, guys, what is the best treatment for the heart block? Yes. So digoxin की जो toxicity है, digoxin toxicity has 3 presentation. One is a heart block. So patient can come to you with heart block. Patient can come to you with ventricle arrhythmia. So digoxin toxicity, patient can come to you with heart block. Patient can come to you with ventricle arrhythmia, or patient can come to you with non-PSVT with heart block. Patient will come to you with non-PSVT with heart block. और non-PSVT में क्या होता है? Like you can see PSVT में what was the problem? PSVT का problem था कि ventricle will also start contracting at high rate. So after atrial fibrillation, after the supraventricular tachycardia, ventricle will start contracting at the same rate. इसे बोलते हैं paroxysmal effect. But when the ventricle will contract at a very slow rate, when the ventricle will contract at very slow rate, this is known as non-PSVT. When the ventricle will contract at very slow rate, तो patient को supraventricular tachycardia है. So atria is contracting at very high rate. Atria is contracting at very high rate, more than 200 beats per minute, but still the ventricle is contracting at very low rate. So this is not a PSVT, this is a non-PSVT. So guys, please remember, digoxin toxicity, when the patient has got heart block, we will give atropine. So atropine is the best antidote. Patient has got ventricle arrhythmia, lidocaine is the antidote, lignocaine is the antidote. But when the patient has got non-PSVT with heart block, then you have to give the digibind. So digibind is the antidote. So here in this patient, you can see patient has got a heart block, patient has got a low ventricle rate. So this is a patient of non-PSVT. So patient has come to us with non-PSVT with heart block. So here the best medicine is digibind. Digibind is the antibody that will go and neutralize the digoxin. That will go and neutralize the digoxin. So these are the 3 presentation of digoxin toxicity. Ventricle arrhythmia में lidocaine, only heart block atropine, and if it is a non-PSVT, and how will you find out the non-PSVT in the exam? Non-PSVT you will find out when the ventricle will contract at very high, very low rate. So ventricle means the pulse rate. The pulse rate is very low and there's a presence of block, but still the patient has got a toxicity of digoxin. So this is a non-PSVT. Here we give the digibyte. Okay. Next question. Question number 17. Which of the, okay, I would like to ask one more thing. What is the mechanism of action of digoxin? Who will tell me what is the mechanism of action of digoxin? Digoxin has 2 mechanism of action. So can any one of you tell me the 2 mechanism of action of digoxin? Digoxin ke, what are the 2 mechanism of action? What are the 2 mechanism of action of digoxin? So this is the medicine which is sodium potassium ATPase inhibitor. So this medicine is sodium potassium ATPase inhibitor, and this medicine is also stimulate the vagus nerve. So this medicine can stimulate the vagus nerve. This medicine is a sodium potassium ATPase inhibitor. These are the 2 mechanism of action of this medicine. Question number 17. Which of the following drug when added with erythromycin can lead to torsades de pointes? So guys, this is an antihistaminic drug. This medicine is withdrawn. So this medicine is already withdrawn from the market. This was an anti-allergic medicine. This medicine is withdrawn from the market because of QT prolongation. So this is one of the old MCQ. This is one of the old MCQ, although they have written it 2024, but this is not asked in 2024. The data is wrong. So this medicine is withdrawn long back, 2012, may around 13 years back, when you people were not born even, I think. No, you people were born. Okay. So this medicine was withdrawn. Medicine can cause QT prolongation. And erythromycin is a liver enzyme inhibitor. Erythromycin is the liver enzyme inhibitor. This will inhibit the metabolism. So this medicine can inhibit the metabolism of estimazole. So erythromycin can inhibit the metabolism of estimazole, and estimazole side effect is QT prolongation. So when you give it with erythromycin, the QT prolongation will be the side effect of this medicine. So question 17, answer is D, the QT prolongation side effect of this medicine. And QT prolongation can result in one arrhythmia. We call it a torsades de pointis. QT prolongation can result in torsades de pointis. Now, who will tell me what is the drug of choice for torsades de pointis? What is the best medicine for torsades de pointis? What is the best medicine for QT prolongation? So QT prolongation, torsades de pointis, what is the best medicine? Answer is magnesium sulfate. Magnesium sulfate is the best medicine for torsades de pointis and QT prolongation. And guys, whenever you get questions on erythromycin, always think about liver enzyme inhibition. मतलब erythromycin का ना practically तो इतना utility नहीं है आज के डेट में. So erythromycin has no utility practically. So whenever the questions are mainly asked on liver enzyme inhibition. Questions are mainly asked on liver enzyme inhibition. Okay. Yes. Now let's move on to the next question. The true statement among the following is, what is the true statement among the following? These are the four statements in front of you. These are the four statements in front of you. The first statement, telmisartan dose should be reduced in renal failure. Right? Irbesartan dose should be reduced in mild to moderate hepatic failure and renal failure. The candesartan dose should be reduced in kidney and liver failure. Losartan acts as thromboxane A2 antagonist and inhibit the platelet aggregation. So which statement is true? They are asking the true statement. Yes, the answer is D, Delhi. So during our class, we made a mnemonic. Like if you remember, we made a mnemonic Go Polo. We made a mnemonic Go Polo. We also made a mnemonic Low Pogo, if you remember. Losartan has two properties. Losartan has two properties. It has an anti-platelet property and anti-gout property. So losartan is a drug which has anti-platelet and anti-gout property. Now the mnemonic is further modified. The Lolo hates polo. Now any idea why the Lolo hates polo? Lolo is Karishma Kapoor. Lolo hates polo. Why Karishma Kapoor hates polo? Any idea? So new mnemonic, Lolo hates polo. Right? So Lolo is Karishma Kapoor. So one mnemonic was low pogo. Losartan has anti-platelet and anti-gout. And second mnemonic was go polo, anti-gout, anti-platelet property with losartan. So answer is D, Delhi. Okay, now who will tell me which angiotensin receptor blocker? Which angiotensin receptor blocker has got approval for migraine? Which has got approval for migraine and which has anti-diabetic property? So what is the name of a angiotensin receptor blocker that is given for migraine? Dr. Aman has said कि polo means the Sanjay Kapoor. Yes, polo means the Sanjay Kapoor. So Sanjay Kapoor died. Her ex-husband died while playing polo. That's why the Lolo hates polo. Okay. Anyone can tell me which angiotensin receptor blocker given for migraine? Yes, the answer is candesartan. So candesartan is a drug that is given for migraine. Now I want to know which angiotensin receptor blocker has anti-diabetic property. Which angiotensin receptor blocker has anti-diabetic property? Yes, the answer is telmisartan. So telmisartan has anti-diabetic property. Telmisartan has anti-diabetic property and candesartan has anti-migraine property. And we have also discussed that telmisartan is a drug which is purely metabolized by liver. Which is purely metabolized by liver. So telmisartan is purely metabolized by liver. So telmisartan is purely metabolized by liver, and this is safe to use in CKD. So this is the medicine which is safe to use in CKD. So there are two things about telmisartan. Telmisartan has anti-diabetic property as well as metabolized by liver. So safe to use in CKD. So these are two things that we people discussed during the class. We made a mnemonic during the class. Tell me किसकी गामा में है दम? If you remember, this medicine will act on PPAR gamma receptor. This medicine will act on PPAR gamma receptor given for diabetes mellitus. So during the class we made a mnemonic, किसकी गामा में है दम? The answer was the जिगर में है दम. So जिगर means the liver. So किस में है दम? Tell me किस में है दम? Dam means the diabetes. जिगर में है दम. Jigar means the liver. So drug is metabolized by the liver. So telmisartan is metabolized by the liver, and telmisartan is given for diabetes mellitus also. Two MCQs we discussed regarding the telmisartan, right? Okay. So question answer is losartan. It has a antiplatelet property. Now I would like to ask one more question from you people. If I say all ACE inhibitors are prodrugs, all AC inhibitors are prodrugs except two. What are the names of those two? So all AC inhibitor, Dr. Suvo has written जिगर में है दम. डॉक्टर सुवो जिगर में जे आएगा ना, जी नहीं आएगा. जी में जी से बाहर निकलो ना, जे में घुसो. जिगर मीन्स द जे. So all ACE inhibitors are prodrugs except which two medicines which are not prodrug? Yes, one is captopril, one is lisinopril. So one is captopril, one is lisinopril. So all medicines are prodrug. One is captopril, one is lisinopril. Right? Captopril, lisinopril are two medicines which are not prodrug. Rest of the medicines are prodrug. Good. So all these things are good that you people know. Let's move on to the next question. A hypertensive patient started on a drug to control his BP. Right? So hypertensive drug started. Patient was started on a drug to control the BP. Now patient has got dry mouth, drowsiness, confusion, but still the patient continued the medicine for 1 year. Now he has forgotten to take the medicine. Now he has got a high BP. So this question we have already covered. This question we have already covered. The patient has forgotten to take the medicine and he has got a high BP. Now which medicine is this? Patient was started on some on some drug. The medicine side effects are dry mouth, drowsiness, confusion. Now when stop the medicine, yes, the answer is clonidine. The patient has got a clonidine withdrawal syndrome. So clonidine withdrawal syndrome will occur. Now in this MCQ, enalapril is a AC inhibitor. Now who will tell me the side effects and contraindications of enalapril? So what are the side effects and contraindications of enalapril? The mnemonic is captopils. So the side effects and contraindications of enalapril, you people have to tell. Yes, this is a case of clonidine withdrawal syndrome. The above is a case of clonidine withdrawal syndrome. The best medicine we discussed in previous MCQ, phentolamine. Phentolamine is the best medicine. Now here I wanted to know the side effects and contraindications of enalaprils. So enalapril ke side effects and contraindication, we made a mnemonic. The C stands for cough, angioedema. C stands for cough, angioedema. P stands for increased potassium. So if you can remember, C is for cough, A is for angioedema, P is for potassium, T is for taste change. Yes, so you can see yes, answer is C is for cough, A is for angioedema. Angioedema होता है कि blood vessels का problem है. So the chemical has come from the blood vessels and causes the angioedema. So angio means the blood vessels edema. So cough, angioedema. P means the potassium, hyperkalemia. Now the T means the taste change. The O means the orthostatic hypotension. Then these are the two contraindications. These are the two contraindications. One is the pregnancy, one is the renal artery stenosis. So pregnancy and renal artery stenosis are two contraindications. So pregnancy and renal artery stenosis are two contraindication. The I means I क्या होता है guys? So P for pregnancy, R for renal artery stenosis. Renal artery stenosis and pregnancy are two contraindication. So medicine side effects are cough, angioedema, hyperkalemia. P is for potassium, T is for taste change, O is for orthostatic hypotension. Then two contraindication, pregnancy and renal artery stenosis. Yes. So ये increase serum creatinine. So ये last year एम्स में आया था. So when the serum creatinine is more than 2.5, when the serum creatinine level is more than 2.5, we should avoid using the medicine. We should avoid using the medicine. And the renal artery stenosis is a contraindication that should be bilateral. So increase serum creatinine, the L stands for lal rash. The L stands for lal rash. So all these things we have discussed during our lecture. These are side effects of medicines. Okay, now let's move on to the next question. A patient with previous history of MI. Patient has got MI with ventricular arrhythmia. So it's very common कि आपको MI हुआ, your ventricle is damaged, and when the ventricle has got injury, ventricle has got an arrhythmia. Now patient is taking treatment for few months. Now he has developed fatigue, dyspnea, and weight gain. Also got a pulmonary fibrosis. So which drug can cause this side effect? So what is the medicine that will cause these kind of side effects? So who will tell me what is the drug of choice for ventricular arrhythmia? So the drug of choice for ventricular arrhythmia is amiodarone. So amiodarone is the drug of choice for ventricular arrhythmia. The second drug of choice is lidocaine. So amiodarone is the best medicine. Lidocaine is the second best medicine. And lidocaine important side effect is CNS toxicity. Lidocaine can cause CNS toxicity where the patient can have the tremors and the seizures. Lidocaine can cause CNS toxicity where the patient will have the tremors and the seizures. Now, amiodarone side effects. Amiodarone side effects, you people have to tell me. Yes, so during the class we made a mnemonic. Please check. So during the class we made a mnemonic. Please check PFT, LFT, and TFT. So during the class we made a mnemonic. Please check PFT, LFT, TFT. So P stands for pigmentation of skin. P stands for pigmentation of skin. C stands for corneal deposits. So P stands for pigmentation of skin. This will cause the blue pigmentation of skin. The C stands for corneal deposits. C stands for corneal deposits. PFT for pulmonary fibrosis. PFT for pulmonary fibrosis given in the MCQ. LFT for liver fibrosis. So PFT for pulmonary fibrosis, LFT for liver fibrosis. And what does this TFT stands for, guys? TFT means the both hyper as well as the hypothyroidism. So this medicine can cause the side effects like uh, P is for pigmentation. So this will result in pigmentation of skin. C is for corneal deposit. So medicine will deposit in cornea. This is known as corneal deposit. PFT for pulmonary fibrosis, LFT for liver fibrosis, and TFT for hyper as well as hypothyroidism side effect of this medicine. So in this MCQ, they are asking the side effect of amiodarone. This is the best medicine for ventricular arrhythmia. So patient has a case of ventricular arrhythmia where amiodarone is given and that will lead to all these side effects. Now let's move on to the next question. What is the name of the drug that is marked in this MCQ? So you people have to answer me. What is the name of a drug which is inhibitor of ACE enzyme? What is the name of the medicine which is inhibitor of neprilysin enzyme? So two enzymes names are given. One is the neprilysin enzyme. So this is the neprilysin enzyme. This is the neprilysin enzyme they have given. So what is the name of the drug which is ACE enzyme inhibitor? So we call them AC inhibitors. We call them AC inhibitors. So AC inhibitors are the drugs which are the ACE enzyme inhibitor and the neprilysin enzyme inhibitor. Who will tell me what is the name of the drug you people know? And that drug is neprilysin enzyme inhibitor. The drug name is sacubitril. Sacubitril is neprilysin enzyme inhibitor and ACE enzyme inhibitor is ACE inhibitors. Now, what is the common side effect of these two medicines? What is the common side effect of ACE inhibitor and sacubitril? Who will tell me the common side effect of sacubitril and the ACE inhibitor? If you tell me the common side effect, you will get a chocolate from my side. What is the common side effect of ACE inhibitor and the sacubitril? Sacubitril and ACE inhibitors. Sacubitril is neprilysin enzyme inhibitor. ACE inhibitors are inhibitor of ACE. The common side effect of both medicine is angioedema. Common side effect of both medicine is angioedema. So both medicines can cause the common side effect as angioedema. Yes, ACE inhibitors are pills. ACE inhibitors are pill, right? So these medicines are pills. So pills will cause angioedema. We discussed few minutes back. Sacubitril will also cause angioedema. As a result of that, we never combine. We never combine ACE inhibitor with sacubitril. Sacubitril ko whenever we want to use sacubitril, we never use alone. We never use alone. So who will tell me the sacubitril is used along with which medicine? Sacubitril ko we cannot combine with ACE inhibitor. We always combine with angiotensin receptor blocker. Sacubitril ko we never combine with ACE inhibitors because both ACE inhibitor and sacubitril can result in common side effect, that is angioedema. Can result in common side effect as angioedema. So we don't combine sacubitril with ACE inhibitor. We combine it with some other drug. So who will tell me the name of that medicine with which we combine this medicine? Very good. We combine the medicine with valsartan. Wonderful answer. So Dr. Suvo has given the answer. So valsartan is a medicine which is an angiotensin receptor blocker. So instead of combining the medicine with ACE inhibitor, we combine the medicine with ARB, and this combination is known as ARNI. And we have discussed that this ARNI is a drug that we use for heart failure, and this will reduce the mortality maximally. So this will reduce the mortality in patients of heart failure. So this is the ARNI. ARNI is a combination of sacubitril. No, it's not losartan, Dr. Manish Modi. It's not losartan, it's valsartan. So sacubitril is given in combination with valsartan. This is the ARNI given for CHF, reduce the mortality. That's why this drug is famous. So guys, there was a clinical trial which was done. There was a clinical trial which was done in which we used this medicine omapetrelate. So omapetrelate was the combined AC inhibitor and the neprilysin enzyme inhibitor. This was the combined AC inhibitor and the neprilysin inhibitor, but this medicine failed the clinical trial due to angioedema. So we cannot block both the enzyme together. We cannot block both the enzyme together. So omapetrelate was a medicine. This was an old MCQ actually. So omapetrelate, the clinical trial was failed because of angioedema, and that's why after omapetrelate failure, we people started using sacubitril as a separate neprilysin enzyme inhibitor. So we started developing the separate neprilysin inhibitor, and we started using this medicine with valsartan. So omapetrelate ke failure ke baad sacubitril hit the market, and now we are using the ARNI as a main drug for CHF. Got it, guys? So in this MCQ, they have asked you, they shown you two arrows. They shown you two arrows, and they ask you ki which medicine can inhibit the both. So the answer is omapetrelate. So omapetrelate will inhibit the both, and the drug was a failure because of angioedema, and that's why we people have come up with the solution. The solution is this one, the ARNI. Let's move on to the next question. You are starting with a treatment regimen containing the angiotensin converting enzyme inhibitor for the patient of CHF. Now, which of the following is true regarding the role? So, why we use AC inhibitors in CHF? So, this question we have already covered. Why we use AC inhibitors in CHF? What is the reason? What is the reason why we use AC inhibitors in CHF? So, the answer is AC inhibitors are given in CHF because they can reduce the mortality, they can improve the survival. So, AC inhibitors can reduce the mortality, improve the survival by prevention of cardiac remodeling. So by prevention of cardiac remodeling, they can reduce the mortality, improve the survival. So they are the main drugs. They are the main drugs. They are the main drugs that we use for CHF. So you can say, I mean, they are the drug of choice. You or not a uh, very good way to answer this question. So there is no drug of choice for heart failure as such. Acute heart failure mein to we have furosemide, but for maintenance treatment we don't have a single drug. We give the multiple drugs actually. So the A is the best answer to be marked. Now here you people have to just tell me again the same answer. What are the seven drugs we have covered? What are the seven medicines we have covered that will reduce mortality in CHF? Who will tell me the names of seven medicines which can decrease mortality and improve survival? Which can decrease mortality and improve survival in CHF? Who will tell me the names of seven medicines? सेवन ड्रग्स के नाम बताओ. एटलीस्ट यू कैनॉट टेल द सेवन ऑल सेवन. एटलीस्ट टेल मी फोर और फाइव. फाइव तो बताओ. Out of 7, at least tell me the 5 medicines, because you can see these topics are frequently asked in your exam. So this is very important. Like not only in your exam, this is asked in NEET PG also very commonly. Okay, Dr. Vijayan has answered AC inhibitor. So one is AC inhibitor, one is ARNI, very good. So 7 medicines which can reduce mortality. One is ARNI, second is AC inhibitor. Okay, next is you people have told me SGLT2 inhibitors. Okay, fine, SGLT2 inhibitors. और बताओ, Dr. Masoom, calcium channel blockers are not associated with reduced mortality. So calcium channel blockers will not come in this category. Yes, so medicines are like ARB, angiotensin receptor blocker. Angiotensin receptor blocker. Medicines can be aldosterone receptor antagonist like spironolactone and beta blockers, right? Beta blockers, and there is a combination of two drugs. Combination of two drugs, two vasodilator. There is a combination of two vasodilator that was also asked in your exam. So ARNI first, ACE inhibitor 2, ARB 3. So ACE inhibitors are Pril, ARBs are Sartan, ARA is like spironolactone, SGLT2 inhibitor is like dapagliflozin. So SGLT2 inhibitors are the gliflozin, dapagliflozin, canagliflozin, and there is a combination of isosorbide dinitrite with hydralazine. So this is what we have discussed in question number 1, and I have discussed the question again because this is something important. This is something very important. Like Manish has said, कि sir 3 beta blockers are approved. One of them is bisoprolol, carvedilol, and metoprolol. So these are the beta blockers which are given for heart failure to reduce the mortality. So these are very, very important for your exam. So guys, don't skip this topic. Okay. Next question. The patient has got some antihypertensive and patient has got this problem. So after taking antihypertensive, patient has got this problem. So can you please tell me which complication is this? What is the complication they have shown in this picture? So which complication they have shown in this picture? So this is a case of angioedema. So this is a case of angioedema, and this is a side effect of which medicine out of these 4? Answer is ACE inhibitors. So ACE inhibitors we have discussed already the side effect and contraindication. The side effect of contraindication of medicines we have already covered. The mnemonic is captopril, we have already covered. So captopril is a mnemonic that we people have already covered. Now let's move on to question number 55. 55? No. A 60-year-old man presented to the OPD with a complaint of blue discoloration of the skin. So now the things are clear. Which medicine can cause blue discoloration of skin? Now patient has got ventricle arrhythmia 3 years back. Patient has got ventricle arrhythmia 3 years back. So which medicine would he be taking? And which medicine, what is the drug of choice for ventricle arrhythmia? If you know the answer, what is the drug of choice for ventricular arrhythmia, the same medicine will cause this side effect. Answer is amiodarone. So amiodarone is the answer of this MCQ. So amiodarone is a medicine, and you know the side effect we discussed in the previous MCQ. Please check PFT, LFT, TFT. So please check PFT, LFT, TFT. These are the MCQs that we have covered. Now lidocaine side effect we have already covered above. Lidocaine can cause CNS toxicity, tremors, and seizures. Adenosine we discussed above already. This will cause bronchospasm. So these 3 drugs are very important for exam, right? So we have covered these medicines in detail. Now let's move on to the next part, the GIT. So GIT mein a patient has undergone surgery. The patient has undergone surgery. Now has a complaint of nausea, vomiting. So after surgery, the patient has got a nausea, vomiting, and you have given a medicine aprepitant. So what is the mechanism of action of aprepitant? Can any one of you tell me what is the mechanism of action of aprepitant? So the mechanism of action of aprepitant is, yes, it is a neurokinin 1 receptor blocker, substance P inhibitor. We also call it substance P inhibitor and the neurokinin 1 receptor blocker. I think the same question asked in the next question, next MCQ. So the question is repeated. Sorry for this. Question is repeated. So aprepitant mechanism of action NK1 blocker. So guys, here I would like to discuss the chemotherapy induced nausea vomiting. So chemotherapy induced nausea vomiting. The anti-cancer drug induced nausea vomiting. Anti-cancer drug will induce vomiting. We call it chemotherapy induced nausea vomiting. Now, chemotherapy induced nausea vomiting maximally caused by cisplatin. So, cisplatin is an anti-cancer drug that will cause maximum of chemotherapy induced nausea vomiting. Now, this vomiting can be the early vomiting, can be the late vomiting. So, if the vomiting will start within 24 hours, we call it early vomiting. If the vomiting will start after 24 hours, we call it late vomiting. Early vomiting का जो drug of choice है, that's a 5-HT3 blocker. Early vomiting drug of choice is 5-HT3 blocker. The medicines end with the word citron. And for late vomiting, the drug of choice is neurokinin 1 receptor blocker. And the medicines end with the word patent. Medicines end with the word patent. So during the class, we people have made a mnemonic. If you come early for the lecture, you will get a seat. If you come late for the lecture, तो पिटोगे. So if you come early, you will get seat. If you come late, तो पिटोगे. Right? So early vomiting, citrons like Ondan citron is used. Right? And late vomiting, patents are the medicines that we use. So this is what we have discussed in this MCQ. They are asking the epripatent having a word pitoge. So this is the medicine which is the neurokinin 1 inhibitors. Now let's move on to the next question. A 32-year-old woman, 32-year-old woman diagnosed with diarrhea due to IBS. So she has got a irritable bowel syndrome. Now she has got a symptom of abdominal pain. Obviously IBS में pain होता ही है females को. Now, she wants a spasmolytic drug. She wants a spasmolytic medicine that will relax the GAT muscles. Now, which medicine can be used? Right? So, which medicine can be used? So, she has got a IBS causing the abdominal pain. Which medicine can be used? So, here the answer is dicyclomine. So, guys, dicyclomine and to some extent scopolamine also. So, dicyclomine is a better answer to mark, which is an anticholinergic drug. So this medicine is an anticholinergic drug. This medicine can relax the GAT muscle. This can be used. Scopolamine can also be given for this purpose, but we use the modified form of scopolamine. Like the name is hyoscine. So the hyoscine ka there is a modified form, hyoscine butyl bromide. So this is the form of scopolamine that we use as a spasmolytic. But this is not a good question to be asked. Very confusing question. The answer can be both, but dicyclomine is a better answer than the scopolamine here. So these medicines are anticholinergic drug. They inhibit the muscarinic receptor, and by inhibiting the muscarinic receptor, these medicines will act as anticholinergic, and anticholinergic drugs will do the opposite to dumbbells. These medicines will do opposite to dumbbells, so they will relax the GAT muscles. So dicyclomine is given for that purpose, right? Yes, scopolamine is also given for motion sickness. Scopolamine is also given for motion sickness. That part we have already covered. Now let's move on to the next question. The patient has got a secretory diarrhea, right? Now secretory diarrhea is a type of non-infective diarrhea. Secretory diarrhea is a type of non-infective diarrhea. And who will tell me what is the drug of choice for non-infective diarrhea? Patient has got a non-infective type of diarrhea. And who will tell me what is the best medicine for non-infective diarrhea? So the best medicine for non-infective diarrhea is loperamide. So loperamide is a drug that will act on mu receptor. Loperamide is an opioid that will act on mu receptor. This is the best medicine to be used, but this medicine cannot cross blood-brain barrier. This is the medicine which cannot cross blood-brain barrier. So although this is an opioid, this will not cause addiction. Loperamide will not cause addiction. This is the best medicine. The second best medicine is atropine. Atropine is anticholinergic. This will relax the GAT muscles. Like the above drugs, dicyclomine, scopolamine. This is also an anticholinergic medicine, atropine. Now, there is a old medicine, diphenoxylate. Diphenoxylate is a old medicine. So these are all ये नीट के questions नहीं है guys. ये सिर्फ आपको divert किया गया. It's not the 2024. This is the old MCQ. There was a time Diphenoxylate was an opioid. This will also act on mu receptor. This also act on mu receptor, and this medicine used to cross blood-brain barrier. And therefore, here the addiction was a big issue. Here the addiction was a big issue, and that is why this diphenoxylate used to be given with atropine. It is used to be given with atropine to decrease the risk of addiction. So we used to give diphenoxylate with atropine to reduce the risk of addiction, right? So here you can say this will prevent the overdose and the abuse of diphenoxylate. So why we give atropine here? Answer is we give atropine here. We give atropine here to prevent this overdose or the addiction of diphenoxylate. And let me tell you guys, non-infective diarrhea, like I can see Dr. Ranjan has answered this question. It is a side effect of anti-cancer therapy. It is a side effect of anti-cancer therapy. So anti-cancer therapy में one of the side effect is nausea vomiting. So how to treat anti-cancer associated nausea vomiting? We have discussed in this MCQ. How to treat anti-cancer drug induced diarrhea? This is discussed in this MCQ. So both vomiting and diarrhea are the common side effects of anti-cancer drugs. How to manage the side effect? This is very important to know. So diphenoxylate is an old medicine given with atropine to prevent its addiction. Next is a patient is undergone chemotherapy and patient requires some antiemetic drugs obviously, and you have given some antiemetic. Now he has got a muscle dystonia, bradykinesia, tremors. So patient has got tremors, dystonia, bradykinesia. So these are the Parkinson's like symptoms. We call them extra pyramidal symptoms. So patient has got extra pyramidal symptoms as a side effect. So now question is, which vomiting wala drug, which antiemetic can cause extra pyramidal symptoms? Which is the antiemetic that will cross blood-brain barrier and can result in extra pyramidal symptoms like tremors, bradykinesia, acute dystonia? कौन सा ड्रग है जो ये साइड इफेक्ट करेगा? आंसर इज metoclopramide. So metoclopramide is a medicine that will cross the blood-brain barrier, and after crossing the blood-brain barrier, this medicine can block the dopamine receptor. Medicine can block the dopamine receptor, and by blocking the dopamine receptor, this medicine can result in extra pyramidal symptom. Medicine can result in extra pyramidal symptoms. So this is the metoclopramide. Guys, can you make some mnemonic? Ki metoclopramide can lead to extra pyramidal symptom. Can you make some mnemonic that metoclopramide can lead to extra pyramidal symptom? Because I have seen your batch is the best batch to make mnemonics. So I realized after teaching so many batches, the worst batch to make mnemonic is the AIMS batch. AIMS ke students never make a mnemonic. I keep on requesting them make some good mnemonic, but they are unable to do so. So can you make some good mnemonic? Unsafe in child and old age. Can you make a mnemonic that metoclopramide can cross blood-brain barrier, block the dopamine receptor, and can lead to Parkinson's like symptoms? Okay, in case you can make it, please send it to me. The next is, guys, topic is autocoids. So in autocoids, you can see the patient has got a breathing difficulty. Patient has got a breathing difficulty, has a nasal polyp, and this has happened after taking aspirin. So this is a semter. So this problem is known as semter. So this is a semter where the patient has got bronchial asthma, nasal polyposis after taking aspirin, and the disease is known as aspirin exacerbated respiratory disease. The condition is known as aspirin exacerbated respiratory disease. We call it AERD, aspirin exacerbated respiratory disease. And what is the drug of choice? What is the drug of choice for this condition? Can any one of you tell me? What is the best medicine for this condition? Yes, this can happen with any NSAID. So whether he has taken aspirin or taken any NSAID. So this can happen with any NSAID, not only aspirin. So this statement is false. This can happen with any NSAID, not only with aspirin. What is a Areva? Dr. Vidya has made a very good mnemonic. Thanks, Vidya. Vidya has said कि metoclopramide में M है. So when we turn the M, this become E. So this will cause extra pyramidal symptom. So metoclopramide is M. M को turn करेंगे, this will become E, extra pyramidal symptom. So this will cause extra pyramidal symptom. Wow, good. So anyone can tell me what is the drug of choice for aspirin exacerbated respiratory disease? So the answer is here. The answer is Montelukast. So Montelukast is a drug of choice for aspirin exacerbated respiratory disease. Montelukast is the best medicine. Montelukast is the best medicine for aspirin exacerbated respiratory disease. And who will tell me the mechanism of action of Montelukast? What is the mechanism of action of Montelukast? So this is the disease known as aspirin exacerbated respiratory disease. That is due to the intake of aspirin. So who will tell me the mechanism of action? Who will tell me the mechanism of action of Mehul has made one more mnemonic of metoclopramide. Mehul has said कि when you meet your ex, then you will lose the body balance. So when you meet your ex, you will lose the body balance. So metoclopramide will cause extra pyramidal symptom where the patient will have the body movement disorder. Patient will have the body movement disorder. Good. One more very good mnemonic. Yes, this is a leukotriene receptor inhibitor. So montelukast is a leukotriene receptor inhibitor. It's a leukotriene receptor inhibitor. Now my next question, can we use montelukast? Can we use montelukast for the treatment of acute bronchial asthma? Can we use montelukast for the treatment of acute bronchial asthma? Can we use montelukast for acute bronchial asthma? Answer is no. So this medicine has a slow onset of action, and because of slow onset of action, I cannot use this medicine for acute bronchial asthma treatment. So I cannot use this medicine for acute bronchial asthma treatment. The drug is montelukast. Montelukast को we cannot use. I cannot use this medicine for acute bronchial asthma. इसका ये drawback है. You people have to remember this point. It's a very very important point that montelukast cannot be given for acute bronchial asthma because of the slow onset. So because of the slow onset, we cannot use montelukast for acute bronchial asthma. Next question: a patient who has got a recurrent attack of gout. Patient is getting a recurrent attack of gout, and you have started with a drug that is inhibitor of uric acid synthesis. Inhibitor of uric acid synthesis. Now, which was the drug? What is the drug that you have started? So, which medicine? No, Dr. Sahani, Montelukast has no role in COPD also. COPD में भी use नहीं कर सकते. Montelukast cannot be useful for COPD, cannot be useful for acute bronchial asthma. Montelukast is only given for maintenance treatment of bronchial asthma. Yes, so we have a drug, allopurinol. We have a medicine, febuxostat. So allopurinol and the febuxostat are the two medicines which are the xanthine oxidase enzyme inhibitor. And by inhibiting the xanthine oxidase enzyme, they can stop the uric acid synthesis. So by stopping the xanthine oxidase, they can stop the uric acid synthesis. So allopurinol and febuxostat are the best medicines for the treatment of gout. They are the best medicines for the treatment of gout. Now guys, can you please tell me which medicine is this? Can you please tell me which medicines are these? P-gluticase. There is a drug P-gluticase. There is a medicine respiricase. So any idea where we can use these medicines? Respiricase and P-gluticase. So respiricase, P-gluticase. Where do we use these medicines? Respiricase, P-gluticase. What are these medicines actually? So guys, these are the recombinant uricase enzyme. So you can see these medicines are the uricase enzyme. Medicines are having a what case? So they are the uricase enzyme, and these medicines can increase the metabolism of uric acid. Medicine can enhance the metabolism of uric acid. and by enhancing the metabolism of uric acid, these medicines can bring the uric acid level down. So these medicines can increase the uric acid metabolism, and we can also use them for the treatment of gout. We can also use them for the treatment of gout. Okay, now here I would like to ask one more question. Out of these four medicine, who will tell me what is the drug of choice for acute case of gout? Which medicine is the drug of choice for acute attack of gout? Like for maintenance treatment, you have marked मेंटेनेंस में लॉन्ग टर्म ट्रीटमेंट में एलोपिरिनॉल इज द बेस्ट मेडिसिन. मेंटेनेंस ट्रीटमेंट में एलोपिरिनॉल इज द बेस्ट मेडिसिन, फेबोक्सोस्टैट इज द ऑल्टरनेटिव. बट व्हाट इज द ड्रग ऑफ चॉइस फॉर एक्यूट अटैक ऑफ गाउट? So which medicine is the best medicine for acute attack of gout out of these four options? In four options में which medicine is the best medicine for acute attack of gout? Yes, so here the answer is NSAIDs. So NSAIDs are drug of choice. NSAIDs में diclofenac. So this was the your FMG question. 2 years back this question was asked. So diclofenac is given in this MCQ. This is an NSAID. So any NSAID given in the MCQ, any NSAID given in the MCQ is the best answer. If it is not given, then go for colchicine. So in case NSAID is not given, then go for colchicine. So acute attack of gout, best is any NSAID given, followed by the colchicine. This is the best treatment for gout, acute attack. Maintenance में allopurinol, febuxostat. Resistant cases में we have the uricase enzyme. Resistant cases में we have the uricase enzyme that can be used. Okay, next question, guys. A young female come to the emergency department. Young female has come to the emergency department after taking 100 tablets of aspirin. So this is a aspirin toxicity. So what is the best treatment? Why not colchicine? Colchicine has lot of side effect, Gaurav. Dr. Gaurav, colchicine is a drug that will lead to many side effects. So NSAID is the best medicine to be given, followed by the colchicine. Indomethacin is an NSAID, guys. Dr. Manish, any NSAID you can give. Like in this MCQ, diclofenac word is given. You can also give indomethacin. क्या issue क्या है? You can give indomethacin. आप उसको ब्रूफिन दे सकते हैं. Indomethacin, aciclofenac, diclofenac, any drug you can give. Okay, so what is the best treatment for aspirin toxicity? Yes, the answer is we can go for forced alkaline diuresis. So the best treatment is forced alkaline diuresis. Now, who will tell me forced alkaline diuresis in which we give sodium bicarbonate to the patient to make the urine alkaline? This is the treatment of choice. This is the treatment of choice for which three medicine toxicity, right? So sodium bicarbonate is given to make the urine alkaline. That will lead to fast elimination of the drug. Now, what are the three medicine? Okay. So what are the three medicines? What are the three medicines that we can use? What are the three medicines for which the forced alkaline diuresis is the treatment of choice? Forced alkaline diuresis is treatment of choice for which three medicine toxicity? You people have to give me the answer. It's a very, very important question. What are the three medicines where the forced alkaline diuresis is the treatment of choice? I think you people are getting this transmission bit late. So when I teach, like when I teach you, you get a transmission after a delay of few seconds. Yes. So we discussed this mnemonic in our class. For three medicine toxicity, forced alkaline diuresis is done. One is methotrexate, aspirin, and phenobarbital. So there are three medicines where we go for forced alkaline diuresis as a treatment of choice: methotrexate, aspirin, and phenobarbital. So methotrexate, aspirin, phenobarbital, best treatment of choice for toxicity is forced alkaline diuresis. Now, who will tell me N-acetylcysteine is given as an antidote of which medicine toxicity? N-acetylcysteine is given as an antidote of choice for which medicine toxicity? So N-acetylcysteine is an antidote of choice for paracetamol toxicity. This is an antidote of choice for paracetamol toxicity. And now last year your FMG question, N-acetylcysteine is given to replenish what? So the answer is this is given to replenish the glutathione, right? So this is given to replenish the glutathione stores. So N-acetylcysteine is an antidote of paracetamol toxicity. It is given as a replacement of glutathione. So glutathione का replacement है N-acetylcysteine. This is the best antidote of paracetamol toxicity. Pralidoxime we have already covered. We use it for organophosphate poisoning. We use it for organophosphate poisoning. And who will tell me glucagon? Glucagon is a best antidote of which medicine toxicity? So glucagon is a best antidote of beta blocker toxicity. So beta blocker toxicity, we give glucagon, right? So pralidoxime for the organophosphate poisoning, glucagon is given for beta blocker toxicity. So glucagon is given as a best antidote of beta blocker toxicity. You people have to tell me the antidote of opioid toxicity. Who will tell me the antidote of opioid toxicity? Who will tell me the treatment of choice for TCA drug toxicity? So tricyclic antidepressant, amitriptyline. So who will tell me the antidote of choice for opioid toxicity? What is the antidote of choice for opioid toxicity? What is the best treatment for TCA toxicity? What is the best treatment for opioid toxicity? What is the best treatment for TCA toxicity? Can any one of you tell me? Yes. So opioid toxicity mein we give naloxone. For opioid toxicity, we give naloxone. And can any one of you tell me which medicine we give for TCA toxicity? Which medicine we give for TCA toxicity? TCA toxicity में, yes, we give sodium bicarbonate. So sodium bicarbonate is not given for making the urine alkaline. This is given to treat the metabolic acidosis. You have to understand, sodium bicarbonate is given in the medicines written on the left side to make the urine alkaline. यहाँ पर हम सोडियम बाइकार्बोनेट दे रहे हैं टू मेक द यूरिन एल्कलाइन, बट इन टीसीए टॉक्सिसिटी we are giving sodium bicarbonate to treat the metabolic acidosis. So we are making the plasma alkaline. Now who will tell me what is the best treatment for benzodiazepine toxicity? What is the best treatment for benzodiazepine toxicity? Benzodiazepine toxicity का best antidote. What is the antidote of choice for benzodiazepine toxicity? Can any one of you recall? Any of you can recall this antidote of choice for benzodiazepine toxicity? So benzodiazepine toxicity, what is the antidote? Yes. So during the class, we people have made a mnemonic flumazenil. So flumazenil is a medicine that will make the maza nil. So flumazenil is the antidote of choice for benzodiazepine toxicity. Benzodiazepine toxicity में flumazenil is given. Okay, now you can see the patient is a case of rheumatoid arthritis. Next MCQ, patient is a case of rheumatoid arthritis from last 15 years. Now she has come for the annual checkup and she has got this problem. She has got this problem, right? So, which anti-rheumatoid drugs, which anti-rheumatoid drug we can use? I mean, which anti-rheumatoid drug must have caused this side effect? So this is a side effect of which medicine? So this is a side effect of chloroquine, hydroxychloroquine sulfate. So we call it a bullseye retinopathy. This is known as bullseye retinopathy. So bullseye retinopathy is an important side effect of hydroxychloroquine, and the risk of this side effect is more. Risk of this side effect is more if you increase the duration of treatment. So more is the duration of treatment, the risk is more. We call it bullseye retinopathy. During the class we have discussed, we made a mnemonic bhais ki aankh. So bhais ki aankh is a side effect of hydroxychloroquine, side effect of this medicine. Now methotrexate is a drug of choice for rheumatoid arthritis. Methotrexate is a drug of choice for rheumatoid arthritis. This medicine has two mechanisms of action. Methotrexate is the drug which has two mechanisms of action. So what are the two mechanisms of action of methotrexate? What are the two mechanisms of action of methotrexate? So methotrexate has two mechanisms of action. This medicine is inhibitor of dihydrofolate reductase enzyme. This is the inhibitor of dihydrofolate reductase enzyme. Stop the synthesis of thymidine monophosphate and hence the DNA cannot multiply. So DNA cannot multiply, so WBC cannot multiply. Now, the medicine which is methotrexate, this will also increase the level of adenosine, and this will contribute in anti-inflammatory property. Yes. So has a this medicine is a DHFRase enzyme inhibitor, dihydrofolate reductase enzyme inhibitor. Methotrexate mechanism of action is very important. Asked in your exam many times. This is a dihydrofolate reductase enzyme inhibitor. Stop the thymidine monophosphate synthesis. TMP synthesis will go down. DNA cannot multiply. WBC cannot multiply. Body immunity will go down. Second, this medicine can increase the level of adenosine and having a anti-inflammatory property. Now, who will tell me which medicine is given to prevent the toxicity of methotrexate? How we can prevent the toxicity of methotrexate? What is the name of the drug that is given along with methotrexate to prevent its toxicity? So if you want to prevent the toxicity of methotrexate, which medicine we can use? What is the name of the drug that we can use to prevent the toxicity of methotrexate? Any idea? The drug name is folinic acid. So folinic acid is the name of a drug which is also known as leucovorin. So leucovorin, folinic acid is the name of a medicine that is used to prevent the methotrexate toxicity. So methotrexate is a best medicine for rheumatoid arthritis. The toxicity is prevented by giving folinic acid with this medicine. Now this same drug, hydroxychloroquine, will also deposit in cornea. You can see this medicine will not only damage the retina, this medicine also deposit in cornea and can lead to corneal deposit. So this medicine can result in corneal deposit. Medicine can result in corneal deposit. Now guys, there is a oral triple regimen. There is a oral triple regimen that we use for rheumatoid arthritis. So who will tell me what are the three oral medicines that we can use for rheumatoid arthritis? What are the three oral medicines that we can use for rheumatoid arthritis? Which is the oral triple regimen that we can use for rheumatoid arthritis? Oral triple regimen, one is methotrexate, second is sulfasalazine. So second is sulfasalazine and the third is HCQS. So this is the oral triple regimen that we use for rheumatoid arthritis very commonly. One is methotrexate, second is sulfasalazine, third is hydroxychloroquine sulfate. Right guys? Now you people have to also remember there are some new drugs for rheumatoid arthritis and that is important for your exam. The medicines are Janus kinase enzyme inhibitor. So we have the medicines which are known as Janus kinase enzyme inhibitor. These medicines are given by oral route. So new medicines which are Janus kinase enzyme inhibitor, they are also given by oral route. Medicines names are tofacitinib and baricitinib. So there are high chances that this time in your FMG exam ये tofacitinib पूछा जाएगा. So tofacitinib is important drug for your this year exam. So these are the new medicines for rheumatoid arthritis given by oral route. We call them Janus kinase enzyme inhibitor. We call them Janus kinase enzyme inhibitor. Medicines are tofacitinib and baricitinib. Right? So we discussed this mnemonic during the class also कि जैक वो वाला जो टाइटैनिक में था, टाइटैनिक मूवी में जो जैक था, जैक आपको तोहफा देगा, बार बार देगा ओरल रूट से. So Jack will give you the tofa bar bar by oral route. So Jack, tofacitinib, baricitinib given by oral route. So these medicines are the new medicines can be asked. There is one more group of medicines, we call them interleukin 6 inhibitors. So the medicine which is interleukin 6 inhibitor, medicine name is tocilizumab. So tocilizumab, sarilumab. So tocilizumab, sarilumab are the medicines which are interleukin 6 inhibitor. So these medicines are also important for exam. Interleukin 6 inhibitor, but they are given by IV route, so they are not by the oral route. So chances are low, but the medicines are tocilizumab, sarilumab. We people have discussed this mnemonic during our lecture that the silly girl will wear 6-meter sari. We made a mnemonic during the lecture. Silly girl will wear 6 meter sari. So silly girl, because the problem belongs to females. So silly girl will wear 6 meter sari. So mnemonic was interleukin 6 inhibitor, tocilizumab, sarilumab. So tocilizumab, sarilumab, silly girl will wear 6 meter sari is the mnemonic to remember. Now the pregnant women with a history of bronchial asthma. Pregnant women with a history of bronchial asthma. She has come to in third stage of labor. Now, which of the following drug is avoided in the management of postpartum hemorrhage? So she has come to you in third stage of labor. Which drug you avoid in the management of the postpartum hemorrhage? So postpartum hemorrhage में कौन सा drug use नहीं होता? So out of these, dinoprostone is a drug that is used for induction of labor. Dinoprostone is a drug that is useful for induction of labor. So this is the prostaglandin E2. This is the prostaglandin E2 analog. We use it for induction of labor, not for the management of postpartum hemorrhage. Carboprost is prostaglandin F2 alpha analog. This is prostaglandin F2 alpha analog. This is the drug of choice for postpartum hemorrhage. This is the drug of choice for postpartum hemorrhage. The drug name is carboprost. So carboprost is the best medicine for postpartum hemorrhage. Oxytocin is also given to contract the uterus. Methergine is also given, but dinoprostone is Serviprime gel. The medicine is available with the brand name of Serviprime gel. So this is applied on the cervix to make the cervix soft. Applied on the cervix to make the cervix soft so that the female can deliver the baby easily. So for the induction of labor, we can use dinoprostone. Carboprost is prostaglandin F2 alpha, best medicine for postpartum hemorrhage. Next question. So last question. Then I think, guys, is like if you are tired, we can take a short break also. So should I finish this lecture directly around 1:15, or you want me to take a small break and we'll restart? Are you people, will you people come back if I take the break? If I take a break for 10 minutes, 15 minutes, will you people come back for the class or no? कि सर अब तो गए अब वापस नहीं आएंगे छोड़ो सर क्या आना or shall we continue like this way and in 1 more hour we'll finish the lecture. Finish, okay, you want me to finish directly? Okay, fine, good, right. Okay, so now some of you are saying break. Okay, let's take a 5-7 minutes break, biological break, है ना? It's already 2.5 hours. So this is the last question, then we'll take a break. Then we start with the CNS and antimicrobial. So we're left with CNS. Then we have the topics like antimicrobials. And after antimicrobials, we have, okay, we are left with hematology, general pharma, and endocrine. So we have topics. So let's better take a break. Better take a break after this. So this topic is based on next topic. Now it is also gone. Okay, so we are left with only one question. There is some problem in the tablet now. It is not starting. So let's take a break for 10 minutes. We'll come back after 10 minutes. Okay. So 10 minutes mein we'll come back and we'll start with this question. So I'm not able to display the question. There is some problem in the tablet. So let's take a break for 10 minutes. Okay. Okay, guys. So we have come after the short break. So I can see some of you are still online, and thanks for waiting. So we were discussing the topic autocoids, and the last question was HIV positive female. The female is HIV positive, and she is on antiretroviral therapy. So female is taking antiretroviral therapy for HIV treatment, and she was also been prescribed ergotamine. So she was given ergotamine for the migraine. So migraine में ergotamine is a medicine that is useful, right? Now she is complaining that she is unable to feel her legs from the mid thigh to her toes from the past 2 days. So she is not able to feel her lower limbs below the thighs. And when you did this angiography, आपने angiography किया, you put a dye in her blood vessels, and you find कि जो blood vessels है, they were intact till this region, and after that you can see there is no blood flow. So blood is not going down. So you can see the blood is not going down. The blood is only available up till the thighs. So which medicine is responsible for this side effect? So she is a HIV positive female. She is on antiretroviral therapy, and she has also taken ergotamine for migraine, and now she is not able to feel her lower limbs. So the and that is also confirmed in angiography that the blood is not going down. What is this problem? So this problem is known as ergotism. This problem is known as ergotism, and this is a side effect of ergot derivative. So this is a side effect of ergot derivative. We call it ergotism. So ergotism is a side effect of ergot derivative. So the ergot derivatives are the outdated medicine these days. So nowadays we people don't give ergotamines to the patients because the patient will develop the side effects like euphoria. So patient will develop the side effects like euphoria. Patient can also develop retroperitoneal fibrosis. So patient can develop the problems like retroperitoneal fibrosis. Patient can develop euphoria. Patient can have the GAT side effects. So GAT side effects like nausea, vomiting as a most common side effect. Patient can also have the optic hallucination. Patient can also have the optic hallucination. Patient can also have the damage to tricuspid valve. So tricuspid valve of the patient will be damaged. So tricuspid valve of the patient will be damaged. Now these medicines can also cause ischemia due to vasoconstriction. Medicine can cause vasoconstriction, ischemia, can result in gangrene also. And this is maximally seen with bromocriptine. This side effect is maximally seen with bromocriptine, and when given to mother, they can contract the uterus. Mother means the pregnant female. When given to pregnant female, they can contract the uterus, and by contracting the uterus, they can result in abortion. So, like in the previous MCQ, we people have covered this medicine, methyl ergometrin. So, methyl ergometrin is a methergin. This is given for PPH, but not given to pregnant females. Otherwise, they can abort. But if they have already got a PPH, then we can use the medicines. Right? Bromocriptine can cause gangrene. Other side effects are tricuspid valve is damaged. Nausea, vomiting can occur. Retroperitoneal fibrosis, maximally caused by methysergide. So this side effect is maximally caused by methysergide. So all these medicines are ergot derivative. You can see the medicines which are ergot derivative, they have the word ERG in their name. So methysergide is having a word ERG. Even the methyl ergometrin is having a word ERG. So it's easy to remember the medicines which are ergot derivative. They will cause the side effect as ergotism. They can lead to the side effect as ergotism. So this female has taken the ergotamine for the migraine, and now she has got a complication. Now, if I ask you this question, what is the drug of choice for acute attack of migraine? So for the treatment of acute attack of migraine, we can use the medicines like NSAIDs. But we can also use the medicines, we call them triptans. So for the acute migraine, we can use the medicines like NSAIDs, and the second group of medicine is triptans. Now, who will tell me the mechanism of action of triptans? How the triptans will act in the body? Triptans are given for the acute migraine. We can use NSAIDs, we can use triptans. What is the mechanism of action? Yes, we can use paracetamol also. For acute migraine, we can use paracetamol also. So paracetamol, NSAIDs and triptan. Here the triptans are the most unique medicines. Who will tell me the mechanism of action? How the triptans will act as a painkiller? So triptans will act on one receptor. We call it serotonin 1B 1D receptor. So this is the mechanism of action. So medicines will act on serotonin 1B 1D receptor, can result in vasoconstriction in the body, and they can relieve the pain. So triptans will act on serotonin 1B 1D receptor, can result in vasoconstriction. As a result of vasoconstriction, they can relieve the migraine. But I cannot use these medicines for hypertensive patients or the heart disease patients. So patients who are hypertensive, patients who have the coronary artery disease, patients who have the peripheral vascular disease. So hypertensive patient, coronary artery disease patients, peripheral vascular disease patients, the medicines are contraindicated. Otherwise, they will cause more vasoconstriction, and therefore the disease can precipitate. So last year in your FMG exam, this question was asked to you. Ki there is a female, you have given a drug to her and she has got angina. So there is a drug given to the female for the migraine and she has got angina. So which medicine you have given? So answer was triptans are the medicines that can be used, or ergotamine also act by the same mechanism. So ergotamine can also cause ischemia. So ischemia is a main issue. Vasoconstriction is a main issue that can be seen with the medicines which are triptans. They will act on serotonin 1B 1D receptor. So this is all about the topic autocoids. Now starting with central nervous system. So first question is, which medicine is useful for the maintenance therapy of opioid addiction? So which medicine is given for maintenance therapy of opioid addiction? So anyone, what is the answer? So which medicine we can use for de-addiction? Which medicine we can use for de-addiction? Out of these four, what is the answer? Which drug is useful for opioid de-addiction? Just read the question like this way. What is the drug that we use for opioid de-addiction? De-addiction के लिए कौन सा ड्रग है यहाँ पे? Yes, the answer is, Are Harjeet, Dr. Abrar, you are answering naloxone. Then what is the drug of choice for opioid toxicity? Opioid toxicity का drug of choice क्या है guys? So you people have to understand, naloxone is an antagonist. Naloxone is an antagonist. This is the drug of choice for toxicity, not for the de-addiction. When you want to become de-addict, you have to take some alternative. You have to understand that when you leave something, when you leave somebody, when you want to leave somebody, when you want to leave something, you want an alternative first. So once you have an alternative, it's easy to leave that person, easy to leave that drug. So we have the medicine like buprenorphine, which is a partial agonist, or we have a drug methadone. So methadone is a full agonist. Buprenorphine is a partial agonist. These medicines are the best medicines for de-addiction. These medicines are the best medicines for cravings. These medicines are the best medicines for opioid withdrawal. So these are the best medicines for opioid withdrawal. These medicines are best medicines for opioid withdrawal, opioids, cravings, and de-addiction. So whenever you have the cravings for someone, you want an alternative, and the alternatives are buprenorphine, methadone. Whenever you have a withdrawal of someone, like someone has gone out of your life, you want an alternative, then you get satisfied. So buprenorphine, methadone can give you that satisfaction. So treatment for de-addiction, cravings, and withdrawal, we have buprenorphine, methadone. For toxicity, we have naloxone, and we have a one more drug, naltrexone. Naltrexone is a medicine. This is the drug of choice to prevent the relapse. This is the best medicine to prevent the relapse. Relapse means the re-intake. So when someone has gone out of your life, assume your partner has gone out of your life. So you will have the withdrawal of that person. So you will take the buprenorphine, methadone. Now, whenever you have the cravings for that person, you can again take the same medicine, and now you will satisfy yourself. Now, once you start living without that person. Your body has adapted, your mind has adapted itself to start living without that person. Now, once you have started living without that person, now you don't want that person should come back. So if you want to prevent the re-entry of that person in your life, when you want to prevent the re-entry of that person in your life, then you have to put a barrier. And that barrier is you will change your phone number. So when you change your phone number, you change your address. So your partner, if that person will realize that you are the wonderful person and he or she wants to come back, then you will put a barrier. She cannot find out, he cannot find out, right? So this is known as relapse. So we want to prevent the relapse. Patients के mind में we put a barrier. The barrier is naltrexone. So naltrexone is a barrier that is given for prevention of relapse. So naltrexone is for prevention of relapse. Naloxone is a fast-acting medicine. This is for toxicity. Naltrexone is slow. This is for prevention of relapse. Naloxone is fast. We give it for toxicity. And buprenorphine, methadone for de-addiction, cravings, and withdrawal. So this is how we have to choose the best answer, right? This is the best way to choose the best answer. And every time, guys, please don't rush for the naloxone. This is what I wanted to say here, because these things are important. So you should not rush for the naloxone directly as the answer. Otherwise, the mistake ho jayega. You have to be very careful in MCQ what exactly they have asked. Okay. Now, if I want to know what is the best medicine for alcohol de-addiction, which medicine is best medicine for alcohol de-addiction, alcohol cravings, right? And prevention of alcohol relapse. So alcohol may we have a different story. So alcohol de-addiction, alcohol craving, alcohol relapse, the best medicine is naltrexone. So naltrexone is the best medicine for alcohol also. You have to understand that naltrexone is given for opioid as well as naltrexone is given for alcohol. But in case of alcohol, we don't have the alternative. Alcohol के केस में we don't have the alternative, and because we don't have the alternative, we are bound to give the blocker, that's a naltrexone. ठीक है, तो अगर आपके पास alternative नहीं है उस person का, the person who has just gone out of your life, if you don't have the alternative, just completely block all the connection and gradually you start living without that person. So naltrexone is a blocker because you don't have the alternative of alcohol. So alcohol de-addiction, alcohol craving, alcohol relapse, naltrexone is given. But if the question is asked to you, what is the best medicine for alcohol withdrawal syndrome? So alcohol withdrawal syndrome, then you will give the benzodiazepine, like you can give the chlordiazepoxide. So chlordiazepoxide is the best medicine. Chlordiazepoxide is the best medicine for alcohol withdrawal. So chlordiazepoxide is the best medicine for alcohol withdrawal syndrome. This is given along with vitamin B1. So alcohol withdrawal, we give chlordiazepoxide with vitamin B1. But for de-addiction, cravings and relapse, we give the naltrexone. So this question is important for your exam. So in case you have any doubt, please ask whenever you have any doubt. Now next question, a patient with a history of mania. A patient has a history of mania and the patient is on lithium therapy. So lithium is a best medicine for bipolar disorder. Now patient has complained to you vomiting and the diarrhea, coarse tremors and ataxic gait. So this is the lithium toxicity. So this is the patient of lithium toxicity. So lithium is a medicine which is a drug of choice for bipolar disorder. Lithium is a best medicine for bipolar disorder. And guys, please remember, whenever we give lithium to a patient, body cannot differentiate between lithium and sodium. Body cannot differentiate between lithium and sodium because they belong to the same column of the periodic table. So because they belong to the same column of periodic table, they have the same properties. And the lithium half-life is approximately 24 hours. Lithium half-life is approximately 24 hours, and this is the best medicine for bipolar disorder. Now, lithium toxicity, like if I say what is the most common side effect of lithium? So the most common side effect of lithium is fine tremors. Most common side effect of lithium is fine tremors. But when you increase the dose of this medicine, when you increase the dose of the medicine, the fine tremors will become the coarse tremors. Now, coarse tremors is a first sign of toxicity. So fine tremors, when you increase the dose, become the coarse tremors. It is a first sign of toxicity of the lithium. And the treatment of choice for lithium toxicity. So whenever this toxicity will occur, like the above patient is getting the toxicity, The treatment of choice for toxicity is IV fluids. So IV fluids best treatment for lithium toxicity. So best treatment for lithium toxicity is IV fluids. So IV fluids is the best treatment for lithium toxicity. Now the question which was asked in NEET exam also, lithium is a drug that is given only by oral route. Lithium is a medicine which is given only by oral route. This medicine cannot be given by IV route, only be given by oral route. So this medicine is given only by oral route, and the lithium toxicity we say when the level will cross the range of 1.5. So lithium toxicity we will say when the level will cross the range of 1.5 and below 1.5 we can treat the patient. So the normal level of the medicine should remain between zero point 0.5 to 1.5. So medicine level should remain between zero point 0.5 to 1.5. Beyond 1.5, we call it toxicity of lithium. So here the medicine is answer is C. Lithium toxicity is taking place when the level will cross the range of 1.5. Next question. A elderly man has got a rigidity and tremors. So elderly patient getting rigidity and tremor. This is a patient of Parkinson's disease. So patient is a case of Parkinson's disease. Now he has a blank facial expression. So the mask-like face, rigidity and tremors. Now which medicine we can use for its management? So which drug is used? The answer is selegiline. Now selegiline is a drug which is a MAO-B inhibitor. This is the medicine which is MAO-B inhibitor, and this will inhibit the dopamine metabolism. So by inhibiting the MAO-B enzyme, this will stop the dopamine metabolism. So the dopamine level will increase in the body, and this dopamine will result in treatment of Parkinsonism. So selegiline is a MAO-B inhibitor, inhibit the dopamine metabolism, increase the level of dopamine, can be given for Parkinsonism. But if question comes to you, what is the drug of choice for Parkinsonism? Drug of choice for Parkinsonism is levodopa. So levodopa is the best medicine for Parkinsonism, but we can also use the medicine selegiline. In this MCQ, instead of selegiline, the more important drug is clozapine. So you people have to tell me about clozapine. Now regarding clozapine, we have endless MCQs. Like itne MCQs hai clozapine mein. You people get tired, but this clozapine MCQs will never be stopped. So who will tell me about clozapine? Clozapine is a second generation antipsychotic. It's a atypical antipsychotic. This is a drug of choice for refractory schizophrenia. So this medicine is drug of choice for refractory schizophrenia. This is the only antipsychotic. This is the only antipsychotic which can reduce suicide. Only antipsychotic which can reduce suicide in psychosis. Best medicine for refractory schizophrenia. Only antipsychotic which can reduce the suicide. And who will tell me the two important side effects of clozapine? Can any one of you tell me the side effects of clozapine? Anyone remember the side effects of clozapine? So clozapine is a medicine. It's the best medicine for refractory schizophrenia. It's the only antipsychotic which can reduce the suicide. What are the side effects of medicine? Yes. So the side effect of medicine is the very important side effect is agranulocytosis. So medicine important side effect is agranulocytosis. I hope we discussed this mnemonic in the class. MAS is the mnemonic I told you. So this medicine can cause myocarditis. This medicine can cause myocarditis. Medicine can cause cyalloria. Medicine can result in seizures also. So medicine can result in seizures, cyalloria, myocarditis, agranulocytosis. Guys, I am getting a question. I am getting a phone call. Sorry. Please wait. Medicine side effects, remember with the mnemonic MAS, that is myocarditis, agranulocytosis, cyalloria, and seizures. So these are the important side effects. Now, you people have to remember, donepezil is a medicine. Donepezil is a drug of choice for dementia. So students make the mnemonic D is for dementia. So donepezil is the best medicine for dementia, and the medicine side effect is diarrhea. medicine side effect is diarrhea. So students make the mnemonic donepezil, dementia and diarrhea. So donepezil is the best medicine for dementia and the side effect is diarrhea. And the alternative, what is the alternative? Because when this medicine will cause diarrhea, we use a medicine rivastigmine. So rivastigmine is the alternative that is used in the form of skin patch. So rivastigmine is a medicine that is used in the form of skin patch. So rivastigmine is an alternative used in the form of skin patch. Alternative of donepezil is rivastigmine that is given in the form of skin patch. So donepezil starts with D, best medicine for D and can cause D, that is diarrhea. Donepezil, dementia, that's Alzheimer disease. Dementia means the Alzheimer's disease, can cause diarrhea. The alternative is rivastigmine, can be given in the form of skin patch. So these are the important things that you people have to understand, right? So endless things like we cannot cover here. So next question, infant present with sudden jerky movements. Infant has come to you with sudden jerky movements of head, neck and arms, right? And you can see the baby movements are hips arrhythmia. Baby will have the hips arrhythmia. And now can you please tell me which condition they have given? If you see this, if you see me, this is the movement. This is the movement. It seems that the baby is doing salam to you. So this is a salam seizure. So baby has the movement of head, neck and arms. This is a salam seizure. We also call it infantile spasm. We call it infantile spasm. Now, which medicine we can use? The medicine that is used is vigabatrin. So you can see the vigabatrin is a drug which is having a word GABA in its name. So it's a GABA transaminase enzyme inhibitor. So you can see from the name of vigabatrin, vigabatrin is a GABA transaminase enzyme inhibitor. So TR means transaminase, IN means inhibitor. So vigabatrin is GABA transaminase inhibitor, and the important side effect of this medicine is vision defect. So you can see the medicine starts with the word VI. So medicine can cause the defects of vision. So the medicine name is vigabatrin. Vigabatrin starts with the word VI, can lead to vision defect, and having a word gabatrin. Gabatrin full form is GABA transaminase inhibitor. Now please remember guys, there is a drug tiagabine. Tiagabine is a transporter inhibitor. So you can see the medicine name starts with the word TI. So this medicine is a transporter inhibitor. So this medicine is a transporter inhibitor of GABA. This medicine is a transporter inhibitor of GABA. You can see the medicine is having a word TI GABA. So transporter inhibitor of GABA. We call it GABA transporter inhibitor. So this medicine is a GABA transporter inhibitor. The drug name is tiagabine. And pregabalin is a drug. Pregabalin is a medicine that is a wonderful drug for the treatment of neuralgia. So this medicine is wonderful drug for neuralgia. So pregabalin, gabapentin are the medicines that we use for neuralgia. So that part we have already covered. Next is, which of the following drug can be used for? Okay, now this is the question based on pregabalin. Which drug is given for diabetic neuropathy, post-herpetic neuralgia, and spinal cord injury? Answer is pregabalin. So pregabalin is given for all the above neuralgia. So guys, can you please quickly tell me what is the drug of choice for trigeminal neuralgia? What is the drug of choice for diabetic neuralgia? So best medicine for trigeminal neuralgia, diabetic neuralgia, post-herpetic neuralgia. So best medicine for post-herpetic neuralgia, best medicine for spinal cord injury neuralgia. So there are four neuralgia which can be asked in your exam. So for trigeminal neuralgia, you will mark the carbamazepine. If carbamazepine is not given, you will mark the gabapentin. So carbamazepine, gabapentin. For diabetic neuralgia, you will mark the deloxetin. So deloxetin is antidepressant. The second you will mark is pregabalin. For post-herpetic neuralgia, you will mark the tricyclic antidepressants. For post-herpetic neuralgia, you will mark the tricyclic antidepressants. The second is pregabalin, gabapentin. Now for spinal cord injury neuralgia, you will mark pregabalin, gabapentin. The second is tricyclic antidepressants. So this is the sequence of the drugs that you follow. You can see pregabalin, gabapentin are drug of choice for only spinal cord injury neuralgia. They are the best medicines for spinal cord injury neuralgia. but they are also the part of almost all neuralgia. They are also the part of almost all neuralgia. For all other neuralgia, they are the second drug of choice. But for spinal cord injury neuralgia, they are the best medicines to be used. So these are the four neuralgias we have covered: trigeminal neuralgia, diabetic neuralgia, post-herpetic neuralgia, and spinal cord injury neuralgia. Let's move on to the next question. A fifth grade student, after receiving multiple complaints from the teacher at school for the repeated episodes of inattention, was brought to the OPD. So mother has given the history of brief spell of staring associated with lips packing movement. So this is which seizure? So this is a absence seizure. So history of a child with no abnormal body movements. So body movements are absent. Body movements are absent. The child is continuously looking at the wall, staring at the wall. This is absence seizure. Now absence seizure can be of two types. Can be typical, can be atypical. Absence seizure can be typical, can be atypical. Now, for typical absence seizure, ethosuximide is the drug of choice. Ethosuximide is the drug of choice. If not given in MCQ, the other medicines can be sodium valproate and lamotrigine. Ethosuximide is the best medicine, followed by sodium valproate and lamotrigine. And for the atypical absence seizure, sodium valproate and lamotrigine will be the first and the second drug of choice. Right? So ethosuximide is a medicine which is a T-type calcium channel blocker. So this medicine is the exclusive T-type calcium channel blocker. So this is a T-type calcium channel blocker, narrow spectrum anti-epileptic medicine. This is the best medicine for typical absence seizure, but for atypical absence seizure, we give sodium valproate and lamotrigine. Moving on to the next question, a 55-year-old patient presented to the dermatology OPD with findings given below. Now, which medicine can cause this adverse effect? So you can see the patient has got this kind of lesion. So pink color lesion, honeycomb appearance. We call it, this is a side effect of amantadine, right? So this side effect is known as livido reticularis. So the side effect is known as livido reticularis. Now this is an old MCQ actually. The drug is outdated, less commonly given. So livido reticularis is a side effect of the amantadine, and this is due to the vasodilation. So this medicine can cause vasodilation. As a result of vasodilation, the patient will have the change in the color. We call it amantadine side effect, livido reticularis. Now in this MCQ guys, there is a drug given as memantine. Now you can see memantine is a drug which is given to improve your memory. So memantine is a drug which is given to improve your memory. This medicine is NMDA receptor blocker. This medicine is a NMDA receptor blocker, and it's a second drug of choice for dementia if the dementia is not controlled by donepezil. If the donepezil is not able to control the dementia, if donepezil is not able to control the dementia, we give the memantine. So memantine starts with MEM. This medicine can also improve the memory, blocker of NMDA receptor. Now we have a medicine trihexyphenidyl. Now the trihexyphenidyl is a benzhexol. Now this medicine we have discussed before also. So who will tell me where do we use this benz? So remember, if you have a benz, then which problem will be solved? So the medicine name is trihexyphenidyl. Trihexyphenidyl have the word 6 hex hex. So benzhexol has the word hex. Trihexyphenidyl also have the word hex. So where do we use this medicine? We discussed already. If you have the Benz with you, if you have a Mercedes Benz with you, 6 Mercedes Benz with you, then the Parkinson's problem will be solved. So this is the medicine that will solve the Parkinson's problem. So Parkinson's problem will be solved. So this is the medicine which is given to control the tremors. This is the medicine that will control the tremors. So this medicine can control the tremors. Parkinson's disease, we can use the medicine trihexyphenidyl. So all these medicines are there, right? Pergolide is a ergot derivative. You can see from its name, this is a ergot derivative. And why the ergot derivatives are outdated these days? Ergot derivatives can cause important side effect that we have already covered. These medicines can cause ergotism. These medicines can cause ergotism. That's why the ergot derivatives are outdated. Now let's move on to the next part. A patient is on opioid therapy. And when he is on opioid therapy, he will develop tolerance to all the actions. He will develop tolerance to all the actions except. So this he will not develop tolerance to meiosis. This is a fact-based question, no logic. He will not develop tolerance to meiosis, constipation, and convulsion. Students make the mnemonic 3C. So 3C means the constriction of pupil. So meiosis ko they read as constriction of pupil. So constipation, convulsion, and the constriction of pupil. So constriction of pupil, constipation, convulsion. These are the three manifestation of opioid against which we will not see any resistance. We will not see any tolerance. Otherwise, the tolerance can be seen against all actions of opioids. Now, opioids are the wonderful painkillers. So, opioids are the drug of choice for cancer associated pain. They are the drug of choice for cancer associated pain. They are the drug of choice for post operative pain. So, best medicines for post operative pain, cancer associated pain by acting on three receptor mu, kappa, and delta, where the mu receptor is most important receptor. Mu is the most important receptor, most common receptor, most important receptor among all. So next question, a patient has come to with OPD with skin rash 3 days ago. Now he has a history of taking some anti-epileptic drug. Now he is diagnosed with a case of Stevens-Johnson syndrome. So which medicine can cause allergic reaction? This is a fact-based question, lamotrigine. So lamotrigine is a medicine. This is a broad spectrum anti-epileptic. So this is a broad spectrum anti-epileptic medicine. And because it's a broad spectrum, it's a second drug of choice for generalized seizure. This is a second drug of choice for generalized seizure, and this is the drug of choice for focal seizures. So this is the medicine of choice for focal seizure, second drug of choice for generalized seizure, and the important side effect of lamotrigine is hypersensitivity reaction. Important side effect of lamotrigine is hypersensitivity reaction. डॉक्टर साहनी wants to know कि कैंसर में ट्रामाडोल का कितना डोज दे सकते हैं. See, Sahani, the maximum dose of tramadol is like the 50 milligram TDS, like 50 morning, 50 afternoon, 50 evening. But अगर पेशेंट को कैंसर है तो ट्रामाडोल मोस्ट ऑफ द केसेस में पेन रिलीव नहीं कर पाएगा. इट्स नॉट अ वेरी स्ट्रॉन्ग ओपियोइड. So better to move to the strong opioids instead of giving tramadol, right? So lamotrigine can cause allergic reaction. Lamotrigine can cause allergic reaction. Lamotrigine is a broad spectrum medicine, second drug of choice for generalized seizure and drug of choice for focal seizure. Now, who will tell me what is the drug of choice for generalized seizure? Which medicine is the drug of choice for generalized seizure? Like, what is the drug of choice for GTCS? Which medicine is the best medicine for GTCS? Lamotrigine is the second. What is the drug of choice for GTCS? What is the drug of choice for GTCS? Yes, topiramate is an anti-epileptic that will cause a renal stone. So Dr. Mehfooz Ali has answered. Topiramate can cause kidney stone. Topiramate, topiramate can cause weight loss. Topiramate can cause kidney stone. Topiramate can cause weight loss. Topiramate can cause glaucoma also. Yes. So the drug of choice for generalized seizure is sodium valproate. Drug of choice for generalized seizure is sodium valproate. Topiramate is a medicine that will cause renal stone, weight loss, glaucoma. Ethosuximide we have also already covered in topic of absence seizure. We already covered in topic of absence seizure. So again the question has come, which of the following drugs are useful for absence seizure? Now you people can mark the answer. Which of the following drugs are useful for absence seizure? So we discussed already, ethosuximide is useful. Valproate is a second drug of choice, and valproate is a drug of choice for atypical absence seizure. Now guys, please remember, carbamazepine is a drug when given in high dose. This medicine can precipitate absence seizure. So this is the medicine which can precipitate absence seizure and the myoclonus seizure. So carbamazepine is contraindicated. Carbamazepine is contraindicated in absence seizure. So the answer is B and C. So B and C are the medicines which are useful. So B and C are the medicines which are given for the treatment of absence seizure. So B and C are the answer. Ethosuximide, valproate, both are useful. Now, if I ask you this question, what are the side effects of carbamazepine? So the side effects of carbamazepine, you can remember with the mnemonic cash. So this medicine can cause cerebellar ataxia. Medicine can cause cerebellar ataxia, diplopia as a side effect. This medicine can cause agranulocytosis. This is the medicine that will cause agranulocytosis. This medicine can cause SIADH like symptom, retain the water, and if you retain the water, the sodium get diluted. Sodium get diluted, hyponatremia, and the H means the hypersensitivity reaction. So this medicine can cause four important side effects. The mnemonic is CASH, C for cerebellar ataxia, agranulocytosis, SIDH, and hypersensitivity. Now please remember, SIDH is a side effect which is more commonly seen with oxcarbazepine. This side effect is more commonly seen with oxcarbazepine than carbamazepine. So carbamazepine side effect SIDH is more commonly seen with oxcarbazepine than carbazepine. Now sodium valproate, the most serious side effect is liver toxicity. This will cause liver toxicity, can result in PCOD like symptoms, liver toxicity that will result in hyperammonemia. Liver toxicity leads to hyperammonemia, can cause PCOD like symptom, and this medicine can cause thrombocytopenia. So can result in thrombocytopenia as one of the side effects. So sodium valproate can cause liver toxicity, PCOD, and the thrombocytopenia as a side effect. So anti-epileptics के side effects are important. Anti-epileptics के side effects are important. You people should be knowing the side effects. Now next topic is antimicrobials. So we talk about antimicrobials. Uh, a diabetic patient presented with rhinitis and the facial swelling. Yes, Dr. Pralay Saha has said that sodium valproate will also cause the neural tube defects. Yes, sodium valproate is teratogenic. Sodium valproate is most teratogenic drug. When given to pregnant female, can cause neural tube defects. So during the class, we made a mnemonic. Like if you remember, the valproate is a mnemonic that we discussed. We discussed a mnemonic valproate. So all those side effects we have covered. Yes. So we have a antimicrobials. Antimicrobials mein the patient is diabetic, immunocompromised patient, got a rhinitis and facial swelling, and biopsy has revealed some fungal infection, and that fungal infection entering in the blood vessels also. So this is a case of mucormycosis. This is a case of mucormycosis. And what is the drug of choice? Drug of choice for mucormycosis is amphotericin B. So there are three medicines that we use for mucormycosis. The mnemonic is PIA. So PIA means the posaconazole. So posaconazole, I stands for isavuconazole. So posaconazole, isavuconazole, and the amphotericin B, where the amphotericin B is a drug of choice for mucormycosis. So amphotericin B, drug of choice for mucormycosis. Now this amphotericin B is also drug of choice for one more serious infection. We call it cryptococcal meningitis. This is also drug of choice for one more serious infection caused by HIV. That's a cryptococcal meningitis. So this is also a drug of choice for cryptococcal meningitis. Now the important side effect of amphotericin B is nephrotoxicity. Important side effect of medicine is nephrotoxicity. So nephrotoxicity, important side effect of amphotericin B. Next is a patient is suffering from tuberculosis and he was put on some anti-tubercular treatment. And while on the anti-tubercular treatment, he was getting a tingling sensation. He was having a tingling sensation and the paresthesias in the lower limbs. But the reason for tingling sensation is not diabetes. It is not, he is not diabetic, so he's not having the neuropathy. So it means this side effect is caused by anti-tubercular drug. So who will tell me which anti-tubercular drug can cause neuropathy? Answer is isoniazid. So this is a side effect of isoniazid. So isoniazid is a medicine that will cause neuropathy as a side effect, and that is due to vitamin B6 deficiency. So we have to give the supplement of vitamin B6 to this patient. Now who will tell me which anti-tubercular drug can cause red-green color blindness? Which anti-tubercular drug will cause red-green color blindness? So red-green color blindness, side effect of which anti-tubercular drug? Which anti-tubercular drug can cause hypersensitivity reaction and can result in bone marrow suppression? Can result in bone marrow suppression, and the same anti-tubercular drug can also result in flu-like symptoms. Can also result in flu-like symptoms. Yes, so this is red-green blindness will cause by ethambutol, and hypersensitivity reaction and the flu-like symptoms caused by rifampicin. So rifampicin will cause hypersensitivity reaction, flu-like symptoms. Ethambutol can result in red-green color blindness. Isoniazid will cause important side effect as neuropathy. Okay, now who will tell me what is the mechanism of action of bedaquiline? So there is a drug bedaquiline. You people have to tell me the mechanism of action and the important side effect. So what is the mechanism of action and the side effect of bedaquiline? The same thing you people tell me about the delamanid. So there is one more TB drug. Who will tell me its mechanism of action and important side effect? So let me give you one hint. Both medicines will lead to common side effect. So both bedaquiline and delamanid can lead to one common side effect. So the common side effect of both medicines are QT prolongation. Both medicines can cause QT prolongation. Both medicines can cause QT prolongation, but one is ATP synthase enzyme inhibitor. One is ATP synthase enzyme inhibitor. The other one is cell wall inhibitor. So delamanid is cell wall inhibitor and bedaquiline is ATP synthase inhibitor, and both medicines are bactericidal. Both drugs are bactericidal drugs for the treatment of tuberculosis. Both medicines are bactericidal for the treatment of tuberculosis. So these are the new medicines for tuberculosis that we people have also covered during our lecture. So this question answer is A. Next question. Patient has got a Plasmodium vivax and falciparum mixed malaria. Patient has got a mixed infection. So mixed infection के लिए which treatment is given on the second day? So can anyone answer this question? Whenever you have got a mixed infection, what do? Mixed infection में you will give the artemisinin combination therapy. You will give the artemisinin combination therapy, right? Artemisinin combination therapy is given, plus you will give the Primaquine for 14 days. You will give Primaquine for 14 days. And in this artemisinin combination therapy, artesunate is given for 3 days, and we have a pyrimethamine and sulfadoxine combination that is given only for 1 day. What is the answer you people are marking? So pyrimethamine sulfadoxine is a single tablet that is given on day one. That is given on day one, and Primaquine also start from day one. Primaquine also start from day one, right? So they are asking which medicines we will give on second day. So second day mein we will not give this pyrimethamine sulfadoxine combination. We will not give pyrimethamine sulfadoxine combination. So we will only give artesunate and Primaquine combination. We will only give artesunate plus Primaquine combination. Pyrimethamine and sulfadoxine we will give on day one only. So these medicines are given on day one. So we will not give the sulfadoxine on day two. So day two पे ये नहीं देते, right? And I hope you understand. When you have to give medicines for 14 days, the dose of the medicine is 0.25 milligram per kg. So the tablet that we use is of 2.5. But when I use Primaquine only for falciparum, the dose is 0.75 milligram per kg. So there the Primaquine dose is 7.5. Like वहाँ पे tablet होता है 7.5. So 14 days में tablet is 2.5, and for falciparum, Vivix में the tablet is 2.5. The falciparum we will give 7.5 tablet. No, pyrimethamine sulfadoxine we give as a single dose. Single dose दिया जाता है. Pyrimethamine sulfadoxine given as a single dose, that is given only on the day one. This is given only on the day one. This is given only on the day one. We don't give it on day two. Artesunate is given for 3 days. So artesunate is given for the 3 days. So second day, third day, we'll give the artesunate. And primaquine is given for 14 days. Primaquine is given for 14 days, starting from day 1 here. But guys, याद रखना फेल्सीपेरम में primaquine is given on day 2. याद रखना ये चीज. Primaquine is given on day 2 in on falciparum. Please don't be confused in this. Like if I ask this question, what is the treatment of P. falciparum malaria? What is the treatment of P. falciparum malaria? You will say we will give artesunate and ACT and primaquine. In this ACT, artesunate is given for 3 days. P plus S, this is given only for 1 day. And primaquine is given as a single dose. Primaquine is given as a single dose only on day 2. So only on day 2 we will give the single dose. Only on day 2 we will give the single dose of the medicine. So 7.5 milligram ke 6 tablets we give. 7.5 ke 6 tablets we give of the single dose. 45 milligram. Yes, very good. So please be careful. Mixed infection में we are giving for 14 days. वाइवेक्स में वी स्टार्ट प्रीमाक्विन फ्रॉम डे 1. तो मिक्स्ड में हम दोनों को मिक्स करते हैं, दोनों ट्रीटमेंट. ये वाइवेक्स का ट्रीटमेंट है, ये फेल्सीपेरम का. तो वाइवेक्स में वी स्टार्ट प्रीमाक्विन फ्रॉम डे 1, बट इन फेल्सीपेरम वी गिव प्रीमाक्विन ओनली ऑन डे 2. So in case you have further confusion, we can discuss this question further in case you want. Otherwise, so the answer to this MCQ is A. Now let's start with okay, who will tell me the primaquine contraindication? What are the 3 contraindications of primaquine? What are the 3 contraindications of primaquine? So primaquine should not be given to pregnant female, should not be given to children, and should not be given to G6PD deficiency patients. So there are 3 contraindications of primaquine: pregnancy, children, and G6PD deficiency. So 3 contraindications of primaquine: pregnancy, children, and G6PD deficiency. 3 contraindication. Pregnancy, children, and G6PD deficiency are the 3 contraindications. So malaria is an important topic. So you should be very thorough with the treatment part. Now, which antibiotic will act on 50S ribosome? So which antibiotic act on 50S ribosome? The answer is linezolid. So linezolid will act on 50S ribosome. This is a protein synthesis inhibitor. So this medicine will act on 50S ribosome, inhibit the protein synthesis. And where do we use this medicine? Linezolid is given for tuberculosis. It is also given for MRSA. There are 2 important indications of linezolid. It is given for TB, it is given for MRSA. And who will tell me the side effects of linezolid? Can any one of you tell me the side effects of linezolid? Linezolid can lead to bone marrow suppression. Linezolid can result in bone marrow suppression. Linezolid can result in serotonin syndrome. Linezolid can result in serotonin syndrome, can result in neuropathy, can result in lactic acidosis. So 4 important side effects of linezolid. The mnemonic is BSNL. The B stands for bone marrow suppression, S stands for serotonin syndrome, N stands for neuropathy, L stands for lactic acidosis. So linezolid will act on 50S ribosome. Now azithromycin is a cell wall inhibitor. It is a cell wall inhibitor. It is a beta-lactam antibiotic. Now daptomycin is cell membrane inhibitor. Daptomycin is cell membrane inhibitor, and rifampicin is RNA polymerase inhibitor. Rifampicin starts with R, RNA polymerase inhibitor. Right? VRSA में drug of choice is daptomycin. Drug of choice for VRSA is daptomycin. There was a time linezolid used to be a drug of choice. So Dr. Pralay Saha, nowadays linezolid no longer useful for VRSA. Daptomycin is the best medicine for VRSA. So best medicine for VRSA is daptomycin. Okay. So next is gray baby syndrome. So gray baby syndrome is a side effect of which medicine? Answer is chloramphenicol. So chloramphenicol is a medicine that will cause gray baby syndrome. So this medicine can cause gray baby syndrome as a side effect. So this medicine has two side effects, bone marrow suppression and gray baby syndrome. So this medicine can cause bone marrow suppression, gray baby syndrome as side effect. Medicine mechanism of action. This will also act on 50S ribosome. Chloramphenicol will also act on 50S ribosome, inhibit protein synthesis. So just like linezolid, protein synthesis inhibitor. And who will tell me about clindamycin? Now, who will tell me the mechanism of action of clindamycin and what is the important side effect of clindamycin? Who will tell me the mechanism of action and important side effect? So, clindamycin is a drug. This will also act on 50S ribosome. This medicine will also act on 50S ribosome, inhibit the protein synthesis. And the important side effect is it has a maximum risk of pseudomembranous colitis. So this is the medicine which has the maximum risk of pseudomembranous colitis. It has a maximum risk of pseudomembranous colitis. Now tetracyclines are the medicines that will act on 30S ribosome. Tetracyclines will act on 30S ribosome, inhibit the transfer RNA. They will act on 30S ribosome, inhibit the transfer RNA, and tetracyclines interfere with the growth of bones and teeth. So they will interfere with the growth of bones and teeth. And once they will interfere with the growth of bones and teeth, they are contraindicated. Tetracyclines are contraindicated in pregnancy as well as in children. So pregnancy and children, tetracyclines are contraindicated. They will cause bone and teeth problem. Now cotrimoxazole is a medicine. This is a folic acid pathway inhibitor. This is a folic acid pathway inhibitor, and because it is a folic acid pathway inhibitor, medicine cannot be given to pregnant female. This medicine cannot be given to pregnant female. One important side effect is this medicine can cause hyperbilirubinemia. Now, because of hyperbilirubinemia, I cannot give this medicine to neonates. So, neonates 2 months of age, the neonates will develop a kernicterus. So cotrimoxazole is inhibitor of folic acid pathway. So anything inhibitor of folic acid pathway cannot be given to pregnant females. And the medicine side effect is hyperbilirubinemia. So cannot be given to children. They will have a kernicterus. Now who will tell me which medicine can cause, which medicines can cause tendon and the cartilage problem? What is the group of the medicines that will interfere with the tendon and cartilage growth? What is the group of the antimicrobial that is contraindicated in pregnancy, contraindicated in pregnancy, and can interfere with the growth and the cartilage of the child, fetus. Fetus की growth, fetus का cartilage and tendon will not develop if you give this medicines to pregnant female. What is the group of the antimicrobial that can cause this problem? Answer is yes. Very good, Dr. Sahani. So, Dr. Sahani, you have a bright chance to clear the exam this time. So, fluoroquinolones, yes, Dr. Mahesh Swaroop, very good. Renu Gupta, good. Yes, the answer is fluoroquinolones. So fluoroquinolones contraindicated. Fluoroquinolones contraindicated in pregnancy. Okay, who will tell me what is the drug of choice for pseudomembranous colitis? Which medicine is drug of choice for pseudomembranous colitis? Which medicine is drug of choice for pseudomembranous colitis? What is the name of the medicine which is drug of choice for pseudomembranous colitis? So pseudomembranous colitis, the best medicine is fidaxomicin. Best medicine fidaxomicin. Second drug of choice vancomycin. So fidaxomicin, best medicine, followed by the vancomycin. No, Dr. Suvo, this is the latest change. Fidaxomicin is a drug of choice. है ना, तो ये एम्स का क्वेश्चन है लास्ट ईयर का. फिडाक्सोमाइसिन इज अ ड्रग ऑफ चॉइस. Second is vancomycin. Now vancomycin used to be the drug of choice, but now the fidaxomicin become the drug of choice for pseudomembranous colitis. So pseudomembranous colitis, fidaxomicin is a drug of choice. Next is an HIV patient developed a fever and dry cough. Now he is diagnosed with TB. Now he is taking some HIV drugs. Now which TB drug should be changed? So can any one of you answer this question? Which TB drug can have a drug interaction? Which TB medicine can have a drug interaction with the HIV drugs? The answer is rifampicin. So rifampicin is a liver enzyme inducer. Rifampicin is a very strong liver enzyme inducer and can induce the metabolism of HIV drugs. So this will induce the metabolism of HIV drugs, and by inducing the metabolism of HIV drug, rifampicin is a medicine that need to change with rifabutin. So this medicine can change with rifabutin. So rifabutin say we can change this medicine, rifampicin. Yes, this is an enzyme inducer. So in this MCQ, the answer is rifampicin. Okay, guys, can you please tell me what is the first line treatment for HIV? What is the first line treatment of HIV that is given to the patient lifelong? What is the triple combination of the drugs that we use for HIV? What is the first line treatment for HIV? So students make the mnemonic. The regimen is delete. So delete is a regimen. So we delete the HIV from our life. So whenever we want to delete HIV from our life, the patient is supposed to take dolutegravir, lamivudine, and tenofovir. So there are three medicine which patient should take: dolutegravir, lamivudine, and tenofovir. Yes, the mnemonic is delete. Now dolutegravir is a integrase enzyme inhibitor. Dolutegravir is integrase enzyme inhibitor. Rest of the two medicines are nucleoside reverse transcriptase inhibitor. Rest of the two medicines are nucleoside reverse transcriptase enzyme inhibitor. Yes, the mnemonic is delete. Nowadays, for the TB prophylaxis, there's a new regimen for TB prophylaxis. We call it a 3 month, 3 month of 3 month of isoniazid. So we give 3 month of isoniazid plus rifampicin. So 3 month of this is a weekly regimen. This is a weekly regimen. So once in a week, patient is supposed to take INH plus rifampicin. This is the new regimen. This is taken for 3 months. This is for the TB prophylaxis. TB prophylaxis. The old regimen was daily INH. The old regimen was daily INH that used to be taken for 6 to 9 months. That used to be taken for 6 to 9 months. So 6 to 9 months of daily isoniazid. This was the old regimen. Now the latest regimen is the medicines are taken only for 3 months. So 3 months के लिए INH rifampicin weekly total 14 dose देते हैं. There's a new regimen. So why this new regimen is better than the old regimen? Because obviously there is a more compliance. There is a more compliance. Patient is more comfortable in taking total 14 doses. Total 14 doses patient is supposed to take. So that's more comfortable instead of the old regimen where the patient is supposed to take the daily medicine for 6 to 9 months. That's a difficult thing. Now, who will tell me what is the latest treatment of TB going on? So, what is the treatment of tuberculosis that we give latest? So, that is a 2-HRZE and the 4-HRE. So, this is the latest regimen that we use for TB. So, this is the treatment and the above is the prophylaxis. The above is the prophylaxis that we have discussed. So TB prophylaxis, and this is the treatment 2-HRZE and 4-HRE. Right now, one of the side effect of HIV drugs, like there is a HIV drug, NRTIs, and the protease inhibitors. So we have the HIV drugs. We call them protease enzyme inhibitor. So all medicines which are protease enzyme inhibitor, they end with the word navir, and all medicines which are NRTIs, nucleoside reverse transcriptase inhibitor, they end with the word woodine. Like we discussed already, integrase inhibitors, they end with the word tigravir. We discussed here, integrase inhibitor, they end with the word tigravir, right? But जो NRTIs हैं, nucleoside reverse transcriptase inhibitor, they end with the word woodine. Protease inhibitor end with the word navir, and they can lead to a common side effect. The common side effect is lipodystrophy. So these medicines have the common side effect as lipodystrophy. There are two group of medicines, two group of HIV drugs which will cause lipodystrophy. One is NRTIs. All medicines end with the word woodine, like the ziduvudine, lamivudine, stavudine. Protease inhibitor medicines name end with the word navir, like the ritonavir, indenavir, all these medicines. The common side effect is lipodystrophy. And to treat this lipodystrophy, we have a drug of choice. We call it a tesamorelin. So tesamorelin is a drug of choice for this. And this medicine is a growth hormone receptor. This is a growth hormone releasing hormone analog. So this medicine is a growth hormone releasing hormone analog. So this medicine is the best medicine for the treatment of lipodystrophy. So difficult question for UL level, है ना? So this question is comparatively difficult question for UL level. So tesamorelin is the drug of choice for lipodystrophy caused by NRTIs, ends with the word woodine, and protease inhibitor, they end with the word navir. Now, what is the drug of choice for scrub typhus? So guys, scrub typhus is caused by rickettsia. Scrub typhus is caused by rickettsia. So, rickettsia is a type of atypical bacteria. Rickettsia is a type of atypical bacteria, right? And for atypical bacteria like rickettsia, like rickettsia, like chlamydia, like mycoplasma. So all these are atypical bacteria, like Legionella. So you people have to remember these four names. These are the atypical bacteria. So these are the four atypical bacteria: Rickettsia, Chlamydia, Mycoplasma, Legionella. Against this atypical bacteria, we cannot use cell wall inhibitors. We cannot use cell membrane inhibitors. Against these four bacteria, I cannot use any drug which is cell wall or cell membrane inhibitor. Atypical bacteria are those bacteria where the cell wall and cell membrane are modified. So whenever you have to rule out some drug, like if I ask you this question, which drug is not given for scrub typhus, then the answer will be I cannot use I cannot use penicillin, I cannot use cephalosporin in this way. So I cannot use cell wall cell membrane inhibitor against these four bacteria because they have the modified cell wall or modified cell membrane. Now against the atypical bacteria, we only use protein synthesis inhibitor or we use DNA gyrase inhibitors. So we use DNA gyrase inhibitor and the protein synthesis inhibitor, right? So in this MCQ, these three medicines are protein synthesis inhibitor and this is the DNA gyrase inhibitor. So this is a DNA gyrase inhibitor, that's a protein synthesis inhibitor. Now chloramphenicol is outdated medicine because of bone marrow suppression. So here the drug of choice is doxycycline. So doxycycline is a drug of choice. If you ask me what is the second drug of choice, the second drug of choice will be the ciprofloxacin. So if the first one is doxy, the second would be the ciprofloxacin that can be used. Azithromycin can also be given to this patient, right? So in this way, you have to find out the best answers. Here's a list of drug of choice we people have given you. You have to just mug up that list. So doxycycline is a drug of choice for scrub typhus. So if the question comes to you, doxycycline is a drug of choice for which conditions? So doxycycline is a drug of choice for all rickettsia infection. So all type of rickettsia infection, this is a drug of choice. This is also the drug of choice for chlamydia. So this is the drug of choice for rickettsia as well as drug of choice for chlamydia. Doxycycline is also drug of choice for cholera. So multiple conditions where this is a drug of choice. So rickettsia, chlamydia, cholera. It is also the drug of choice for Lyme disease. Also the drug of choice for leptospira. So doxycycline, drug of choice for rickettsia, chlamydia, cholera, Lyme disease, leptospira. So all these conditions, doxycycline is a drug of choice. So guys, because of the lack of time, please go through the list of drug of choice we people have given to in the class. That will solve this kind of MCQs. Next question. A middle-aged man presented with gynecomastia. So this is the gynecomastia. So middle-aged man has got a gynecomastia. So which medicines can cause gynecomastia? Which medicines can cause gynecomastia as a side effect? So we discussed this mnemonic so many times during our lecture. The mnemonic is DISCO. So in this mnemonic of DISCO, which medicines will cause gynecomastia? Digoxin can cause, spironolactone can cause. Spironolactone can cause gynecomastia. We have a drug cimetidine. Cimetidine is a drug that will cause. Ketoconazole can cause. and any medicine that contains estrogen. Any medicine that will cause estrogen, that will also cause gynecomastia. So the mnemonic is DISCO. DI means the digoxin, S means the spironolactone, C means the cimetidine, K means the ketoconazole, O means the estrogen. So patient has got this problem. So which medicine has caused? The answer is ketoconazole. So ketoconazole is a medicine which has caused this problem. Now here in this question, fluconazole is an antifungal. So all these medicines are antifungal. Now these medicines are known as azoles. So these medicines are cell membrane inhibitors. Azoles are the medicines which are the cell membrane inhibitor of the fungus. They are the cell membrane inhibitor, and fluconazole is a drug of choice for Candida albicans. Fluconazole is a drug of choice for Candida albicans. Itraconazole is a drug of choice for most of the skin infection. So skin infection को we call tinea. Itraconazole is a drug of choice for tinea. Fluconazole is a drug of choice for Candida. Voriconazole is a drug of choice for aspergillosis. Voriconazole, drug of choice for aspergillosis. Itraconazole for tinea. Fluconazole is the best medicine for Candida. Ketoconazole ko we don't use as antifungal these days. Like we don't give it by the systemic route. Ketoconazole ko we don't use by systemic route. So that is the answer of this MCQ. This will cause gynecomastia. Now let's talk about the drug of choice. So again, the list is with you people. So who will tell me bacteroids ka what is the drug of choice? So bacteroids is an anaerobic bacteria. This is an anaerobic bacteria, and whenever the patient is infected with the anaerobic bacteria, we always prefer to use metronidazole. So metronidazole is a group of medicines that we can use. We can also use penicillins. We can also use carbapinims. So these are the three group of medicines that we can use against anaerobic bacteria. So anaerobic bacteria mein metronidazole is the first one. We can also use penicillin and carbapinims. So hence bacteroids mein the best medicine is metronidazole. Now what is the drug of choice for MRSA? MRSA ka drug of choice is vancomycin that we have already covered. Right? Now we have a Haemophilus ducreyi. Now Haemophilus ducreyi is a bacteria that will cause chancroid. Chancroid is a STD, and the drug of choice is azithromycin. So azithromycin is the drug of choice for this condition. So Haemophilus ducreyi is a chancroid, that is azithromycin. Okay, so they have not given the azithromycin, but no problem. We have a Klebsiella. Now Klebsiella is a bacteria that is a kind of a resistant bacteria nowadays. So this is a kind of a resistant bacteria. It is difficult to kill this bacteria, so we have to give carbapinims. Can you remember one point? Okay, leave that point. So Klebsiella is the resistant bacteria. Carbapinims are the best medicines for carbapinims are the best medicines for Klebsiella. Right. So in this MCQ, although they have given the wrong drug for Haemophilus ducreyi, so meropenem is a carbapenem. This is for this. So we are left with only one option. Penicillin is a C option we are supposed to mark, but nowadays we don't give penicillin for this. Right. So the best answer here is um, A is 2. So this is the answer. I think B is 1. C is 4. Yes. So this is the answer of this MCQ. Klebsiella, uh, the first time the most severe resistance is found in Klebsiella. So they, बहुत landmark discovery है. This is a very landmark discovery of Klebsiella. That if they will ask you कि first time the strongest resistance discovered in which bacteria, the answer is Klebsiella. And to overcome that resistance, we people discovered carbapinims. तो वहां पे हमें carbapinims बनाने पड़े. So carbapinims we people needed to discover to fight with that type of resistant Klebsiella. That's why this is important. Now, what is the action of amphotericin B? So amphotericin B is a cell membrane inhibitor. Amphotericin B is a cell membrane inhibitor. This medicine can form pores in the cell membrane, and through these pores, the nutrients will leak out. Through the pores, nutrients will leak out. So amphotericin B, we have discussed above, it's the best medicine for mucormycosis and cryptococcal meningitis. Right? Okay. Next question. A woman presented with UTI, okay, and that causes tendon rupture and arthropathy. So ये pregnant होना चाहिए था. This is a pregnant women presented with symptoms of UTI, and you have given some drug, and the baby is now developed the tendon rupture and arthropathy. So this is a side effect of fluoroquinolones. So fluoroquinolones are the DNA gyrase inhibitor. They are the frontline medicines for UTI. So they can cause tendon rupture and the problem of cartilage. Got it? So this is all about this topic, antimicrobials. Now let's talk about hematology fast. So hematology, a patient of hypertriglyceridemia. So patient triglyceride level was high. You started on some medication. You started some medication. Now after that, the patient has developed flushing, skin flushing, LFT problem. So which medicine can cause this problem? The answer is niacin. So niacin is an outdated medicine for hyperlipidemia. Niacin is an outdated medicine for hyperlipidemia. So there are three group of medicines. One is statins. Statins are HMG-CoA reductase enzyme inhibitors. They are the drug of choice for hypercholesterolemia. Second group of medicines are fibrates. So this is a fenofibrate. So statin mein there is examples. This we have an example fenofibrate. Now this fibrate will act on PPAR alpha receptor. This will act on PPAR alpha receptor. This is a drug of choice for hypertriglyceridemia. And there is a drug niacin. This medicine can increase the level of HDL. So these are the three medicines: statins, fibrates, and niacin. All these three medicines can lead to common side effect. All these three medicines can lead to common side effects. The common side effects you can remember with the mnemonic HMG. So all these three medicines can cause hepatotoxicity. All these three medicines can cause myopathy. All these three medicines can cause hyperglycemia. So all the three medicines can cause the common side effect as HMG, hepatotoxicity, myopathy, and hyperglycemia. Statins are the best medicines for hypercholesterolemia. Fibrates are the best medicines for hypertriglyceridemia. Niacin can be given to increase the HDL. Now, all the three medicines can lead to common side effect as HMG, and the maximum side effect is caused by niacin. That's why the niacin is outdated. So, niacin is outdated because this medicine will cause maximum damage to liver, maximum myopathy, maximum diabetes. That's why the niacin is outdated. Right? So, in this MCQ, the answer is niacin. Next is, what is the mechanism of action of tissue plasminogen activator? So guys, please remember, any medicine that ends with our T place, any medicine that ends with our T place, like the altiplase, we have an example like retiplase, we have a medicine like tinectiplase. So all these medicines end with our T place. So T place full form is tissue plasminogen activators, tissue plasminogen enhancers. So these medicines, they end with the word tissue plasminogen enhancers. All these medicines enhance the plasminogen. They activate the plasminogen to plasmin. They activate the plasminogen to plasmin, and once they will enhance this plasminogen to plasmin, they will have the fibrinolytic property. So these medicines have fibrinolytic property. By enhancing the plasminogen to plasmin, they will degrade the fibrin. So they will enhance the fibrin, and whenever we have to give their antidote, the antidote will be the inhibitor of tissue plasminogen activation. Antidote will be the inhibition of the tissue plasminogen activation. The antidote name is YACA, If IACA is not given, the antidote will be the Trenexa. So IACA will be the antidote. The second antidote is Trenexa. So epsilon amino caproic acid and tranexamic acid, epsilon amino caproic acid and tranexamic acid, they are the antidote of choice for the fibrinolytic medicines. So they are given for the fibrin degradation. Now we have a new medicine which is a PCSK9 inhibitor. So which drug is PCSK9 inhibitor? The drug name is evolocumab. So evolocumab is a drug. This medicine can result in increased cholesterol uptake. You can see in the name of the drug we have a word Cu. So this medicine can result in cholesterol uptake from the plasma. So this medicine can result in more uptake of cholesterol from the plasma by inhibiting this enzyme PCSK9 enzyme, and this medicine is second drug of choice for hypercholesterolemia. The second drug of choice for hypercholesterolemia after statins. Statins के बाद evolocumab is a second drug of choice. So evolocumab is a second drug of choice for hypercholesterolemia after statins. So this is an important drug because they have already asked this question in AIMS and NEET both. दोनों एग्जाम में evolocumab they have asked. So Cu means the cholesterol uptake. So medicine is meant for cholesterol. Now next question, a patient with DVT. A patient with DVT started with a new drug. Now after 2 days, patient has got a complication that is given here. So which drug is responsible? So this is the complication that is known as skin necrosis. So this side effect is known as skin necrosis, and this is a side effect of warfarin. So warfarin is a drug. Warfarin is a drug when given to a patient. This will cause deficiency of protein C and protein S in the body. This will cause deficiency of protein C and protein S, and hence this will cause hypercoagulation. This will result in hypercoagulation, and as a result of hypercoagulation, the patient will develop the skin necrosis as a side effect. So warfarin is a medicine that will cause this problem. So guys, let's finish this paper fast because we have a time limit of around 2:15 or 2 o'clock. So in case you have any doubt in any question, please ask. Right. So I'm just telling you the answers now. So this is the uh, photograph that is showing you the activity of tissue plasminogen activator. So tissue plasminogen activator, they will activate plasminogen to plasmin, and now they can degrade the fibrin plot. So they are asking which medicine can inhibit. Which medicine can inhibit this conversion? So we discussed already above. The medicine is IACA. So IACA and the Trenexa. So IACA and the Trenexa are the antidotes. They are given to inhibit this conversion. So answer is B. Next is a patient of malignancy undergoing the chemotherapy. Patient of malignancy undergoing the chemotherapy, the platelet count has gone down. So which medicine is given to increase the platelet count? Which medicine is given to increase the platelet count? So platelets का जो natural growth factor है, platelets natural growth factor is interleukin 11. So interleukin 11 is the natural growth factor for platelets. So we have a drug oprelvicin. So oprelvicin ends with the word kin. So this will act like a interleukin. So this medicine can be used. We can use the other medicine like the romiplostim. So romiplostim is a drug which ends with the word stim. So this is a stimulator of platelet. So romiplostim, oprelvicin. We have a drug like L-trombopeg. So these are the medicines. So trombopeg is having a word thrombocyte. So this medicine is having a word thrombocytes, and romiplostim is having a word PL. It's a platelet stimulator. Now filgrastim is a stimulator. It is a stimulator of WBC. Erythropoietin is stimulator of RBC. The drug name is darbepoetin. This is a darbepoetin. So RBC increase होता है darbepoetin से, which is a erythropoietin. Filgrastim, that's a granulocyte stimulator, increase WBC. Amifostin is given to prevent the cisplatin nephrotoxicity. So if you want to prevent the nephrotoxicity of cisplatin, amifostin is given. So amifostin is given to prevent the nephrotoxicity caused by the cisplatin. Next is a young patient started on a weight loss medication. that acts by inhibiting the fat absorption. So weight loss medicine that will stop the fat absorption, right? So that will cause loss of fat soluble vitamin. So that will cause loss of fat soluble vitamins. So that will cause loss of fat soluble vitamin. Now she has got a increased risk of bleeding. She has got a menorrhagia and easy bruising. So which vitamin deficiency can be there? So this is a vitamin K deficiency. So when you give a medicine that will cause loss of fats absorption from the food. So fat is not absorbed. So the fat soluble vitamins are not absorbed. And and the which vitamin deficiency will cause bleeding? Answer is vitamin K. So vitamin K is the answer. Next is a patient is having a non-valvular atrial fibrillation. So non-valvular atrial fibrillation. So valve is not involved. Only atrial fibrillation is there. And he was given warfarin tablet. So when you give warfarin, there are four clotting factors which are decreased. There are four clotting factors. The level of these four clotting factors will decrease. So they are asking which is the first clotting factor that is decreased. Answer is factor 7. So earliest is factor 7 and the last is factor 2. So out of 2, 7, 9, 10, the 7 is the earliest, the last is factor 2. Is right. So answer is B, Bombay. Now we have a general pharmacology. In general pharmacology, lidocaine is the drug that we use for arrhythmia, and the loading dose of the drug depends upon which factor. So what is the formula for the loading dose? The loading dose depends upon two factors: volume of distribution and the plasma concentration. So this is the formula for the loading dose, and the formula for the maintenance dose is clearance and the plasma concentration. So loading dose depends upon two factors: volume of distribution. Please make a correction. Loading dose depends upon volume of distribution, plasma concentration divided by the bioavailability, right? And the maintenance dose depends upon clearance, plasma concentration, and the bioavailability, right? So this is the formula. So they are asking the loading dose depends upon which factor. So answer is volume of distribution. But if they will ask you what are the other factors on which volume of distribution depends, what are the other factors on which the loading dose depends, the answer will be plasma concentration as well as the bioavailability. Right? So best answer is it is directly proportional to volume of distribution. Second best answer will be the bioavailability here. So bioavailability we assume is inversely proportional. Volume of distribution, it is directly proportional. Now, in which phase of clinical trial drug dosing is done? So drug dosing is done in all three phases of clinical trials. So drug dosing is done in all three phases of clinical trial. So I think this should be except. So except is phase 4. So drug dosing is done in all three phases of clinical trial, phase 1, 2, 3, but not done in phase 4. Phase 4 is post-marketing surveillance. So here we don't do any dosing. Now, a patient given digoxin and the level is 4, you want the level to be 1. The level is 4 and you want ki level 1 ho jaye. And the medicine half-life is 40 hours. Then how much you have to wait? The medicine level is 4 and you want the level become 1. So 4 say 1 you want. So and the half-life is 40 hours. So after the first 40 hours, this become 2. It becomes half. Next 40 hours, it becomes 1. So the 4 become 1 after the gap of 80 hours. So 4 will become 1 after the gap of 80 hours. So 80 hours will be the answer. 80 hours will be the answer. Right? Next question. 500 milligram of drug was given to the patient. 500 milligram of the drug is given to the patient. 100 milligram was cleared in 1 hour. So how much drug is left after 3 hours if a medicine follows zero order kinetics? So in zero order kinetics, amount of drug that is eliminated from body is constant. Amount of drug that is eliminated from body is constant. That is a rate of elimination. We also call it rate of elimination. So rate of elimination remain constant in zero order kinetics. So in the above case, the rate of elimination is 100 milligram drug is eliminating per hour. This is the rate of elimination. 100 milligram drug is eliminating per hour, and this will remain constant. So they are asking how much drug will eliminate after 3 hours. Answer is 300. Out of 500, 300 drug is eliminated. So how much drug is left? Answer is 200. So 200 milligram drug is left after 3 hours in the body. Right? Now, next question. A patient weight 50 kg has acute severe asthma. Now you have given theophylline to this patient. 50 kg person having a severe asthma, theophylline is given, and this is the plasma concentration. This is the plasma concentration we have achieved, and the volume distribution is this. So what will be the loading dose? So we know that the loading dose is equal to volume distribution into plasma concentration, and the formula for volume of distribution is dose upon plasma concentration, right? So this will cancel each other. So what is the dose that you are giving to the patient? That will be your loading dose, right? So that will be your loading dose. Okay, so they have given you the value of volume distribution, sorry. So the volume distribution they have given is 0.6 liter per kg. So the per kg is 50 kg. And the plasma concentration they have given is 10 milligram. So 0.6 liter per kg is the volume distribution. So per kg means total 50 kg. So patient is of 50 kg, right? So this comes out to be how much, guys? Kitna hoga? 6 5 are 30, 300. So 300 is the answer. Now calculate the therapeutic index of the drug. Calculate the therapeutic index of the drug from the DRC given below. So DRC given below. So this is the DRC. So what is the therapeutic index? Therapeutic index is given by lethal dose 50 divided by effective dose 50. So therapeutic index is index of safety. So this is the index of safety. This is the index of safety. Lethal dose divided by effective dose. So what is the lethal dose? You can see this is the lethal dose 50, 400. So 400 is the lethal dose. So this is the dose. And effective dose, you can see this is the effective dose 50. That's 100. Effective dose is 100. Lethal dose is 400. So therapeutic index is 4. Now guys, please remember, if the therapeutic index is more than 2, we will say the medicine has wide therapeutic index. If the therapeutic index is less than 2, then we will say the medicine has narrow therapeutic index. So this is the medicine which has a therapeutic index 4. Medicine has wide therapeutic index. So the answer is C. So medicine has wide therapeutic index. From the graph, we can find out the value. The answer is 4. Now this is the DRC, and they are asking which drug has highest potency. So for potency, we have to see the left side DRC. So the medicine which has the left side DRC, that's a most potent medicine. So here A is the most potent medicine. The second thing is efficacy. So in this graph, you can see A is on the left side of the B and then C. So A is most potent. And for the efficacy, you see the height of DRC. You see the height of DRC. So here you will say A and B have equal efficacy, but this is more than C. So for potency, you will say A followed by B followed by C. So A is most potent followed by B, then C. Then for efficacy, you will see the height. So in height, the A and B have equal height. A and B has equal height. So you will say A and B have equal efficacy, but this is definitely more than C. Next is a drug solution. Okay, leave this question, not important. We'll do it later on and not important. Next is a patient is on long-term anticoagulation therapy. Patient is on long-term anticoagulation therapy with warfarin. Now would need to increase the dose when given with which drug? So if you give it with rifampicin, rifampicin is a liver enzyme inducer. This will induce the metabolism of warfarin. So you need to increase the dose of warfarin. Now erythromycin is a liver enzyme inhibitor. We discussed in one of the previous question. So along with erythromycin, you have to decrease the dose. and along with rifampicin you have to increase the dose. So in this MCQ you people have to know about the inducers and the inhibitors. So the list of inducers and inhibitors are important. तो जो inducers हैं, the mnemonic is car gas, we have discussed in class. The medicines which are inhibitor, the list is peacock. So peacock are inhibitor, in car gas are inducer. The last topic, anti-cancer drugs. We're left with only 3 or 4 questions more. So a 7-year-old boy presented with 2 week history of persistent fever, fatigue, and pallor. He has got a petechiae on his legs, hepatosplenomegaly. तो ये वो है ल्यूकीमिया का केस है. Patient has got a leukemia. So leukemia में which medicines we give? So which medicines we can give to this patient? So you can see doxorubicin and idarubicin. So they belong to same class. So they are the medicines that belong to same class. So this cannot be the regimen that we can use. So here we give this regimen prednisolone plus vincristine. So both medicines belong to the same class. We call them ruby. So ruby medicines not given together, and we have to give some anti-cancer for leukemia, lymphoma. Then prednisolone plus vincristine combination can be used. Now next is which drug is given for multiple myeloma. So guys, please remember the drug of choice for multiple myeloma is bortezomib. Drug of choice for multiple myeloma is bortezomib, and bortezomib has a side effect of herpes zoster, so the answer is bortezomib. So bortezomib is the best medicine for multiple myeloma. Bortezomib is the best medicine for multiple myeloma. Next is the patient has got gynecological malignancy, so choriocarcinoma. So choriocarcinoma, the drug of choice is methotrexate. Obstetric malignancy basically, not gynecological, obstetric malignancy. Drug of choice methotrexate. Now, what is the mechanism of action? So that we have already covered. This is inhibitor of TMP. So this medicine is inhibitor of thymidine monophosphate, and to prevent the side effect of medicines like the oral and gastric ulcers, we can give leucovorin. We can give leucovorin or the folinic acid along with this medicine. We can give folinic acid or the leucovorin along with this medicine. Next is a patient will undergo chemotherapy for the testicular cancer, and patient has got a pulmonary fibrosis. So which anti-cancer drug can cause pulmonary fibrosis? Which anti-cancer drug can cause pulmonary fibrosis? The answer is testicular cancer में the regimen we use is BEP regimen, and in this BEP regimen B stands for bleomycin. So bleomycin is a drug that will cause pulmonary fibrosis. So bleomycin is a medicine that will cause pulmonary fibrosis. And one more side effect is this medicine can cause skin pigmentation. This is the medicine that will cause pigmentation of skin, and that will cause the skin pigmentation that is in a shape of a bacterial flagella. This will cause skin pigmentation in the shape of a bacterial flagella. So in the shape of a bacterial flagella, this medicine can cause skin pigmentation. Now cisplatin is a drug that will cause maximum chemotherapy induced nausea vomiting. This medicine will also cause maximum nephrotoxicity. This will cause maximum nephrotoxicity. This medicine will also cause maximum sensory neurotoxicity. So this medicine will cause maximum sensory neurotoxicity, maximum nephrotoxicity, maximum vomiting. Now we discussed already nephrotoxicity के लिए we give amiloride. Sorry. So along with cisplatin we give amifostine. So amifostine is given to prevent the side effect. And for vomiting, how we control that we have already covered. Now methotrexate side effects we have already covered in one of the previous MCQ. And to prevent the side effect, we give leucovorin. And actinomycin D is a medicine. This medicine can cause cardiotoxicity. Okay, not this medicine. Actinomycin D, nothing important. Just remember, this is a medicine that we can use for Ewing sarcoma. We can use this medicine for bone cancer, Ewing sarcoma. There is a drug doxorubicin. Doxorubicin is a medicine. This medicine can cause important side effect as cardiotoxicity. So this is the drug which will cause cardiotoxicity as an important side effect, doxorubicin. And to prevent this side effect, we give a medicine along with it that is known as dexrazoxin. So dexrazoxin is a medicine that is given with doxorubicin to prevent the side effect. We have one more drug, cyclophosphamide. Cyclophosphamide is a medicine. This medicine can cause hemorrhagic cystitis. This medicine can cause important side effect as hemorrhagic cystitis. And if you want to prevent this side effect, we have to give a medicine Mesna. So Mesna is given to prevent hemorrhagic cystitis. Doxorubicin can cause cardiotoxicity prevented by dexrazoxin. Hemorrhagic cystitis prevented by Mesna. Right? The question which was asked in your exam, there is a drug capecitabine. So capecitabine can cause a side effect. We call it hand and foot syndrome. So hand and foot syndrome, important side effect of capecitabine. And guys, like as I mentioned in the class also, recently in your exam, they have started asking questions from anti-cancer. Like last time, there are 3 questions from anti-cancer. So whatever notes we people have given you in the class, please revise those notes. Don't neglect this topic because last time there are 3 MCQs from this topic. So anti-cancer code, don't take it lightly. It's an important topic for your FMG now. Like there was a time when FMG mein there was not even a single MCQ they asked from the anti-cancer, but recently they have started asking many questions. Endocrine is a topic where they're asking less questions. So endocrine mein you people have to be very superficial. You have to go very superficial. So the first question of endocrine, the based on acromegaly. The patient has got acromegaly. So patient is suffering from acromegaly. And for the acromegaly, please remember the drug of choice is octreotide. Acromegaly, drug of choice is octreotide. If it is not controlled, we will give the pegvisomant. We will give the pegvisomant, and pegvisomant is a growth hormone receptor antagonist. You can see from its name, this is an antagonist of somatropin hormone. So somatropin receptor antagonist pegvisomant. But the drug of choice is octreotide or the lenriotide. So lenriotide, octreotide are the somatostatin analog. So these medicines are the somatostatin analogs. So they are the drug of choice. But in case the condition is not controlled, we add the pegvisomant in the patient treatment. So answer is B. Now, which medicine can cause pleural pathology? So we discussed already. So which will not cause? So metformin is a medicine of diabetes that will not cause pleural pathology. We discussed that methisergide is a ergot derivative. So this is the ergot derivative that will cause fibrosis everywhere. So this will cause pleural fibrosis. Bleomycin can also cause fibrosis. We have covered above. And nitrofurantoin is an antibiotic given for UTI. This medicine can also cause fibrosis. So all the 3 medicines can cause pleural fibrosis. Metformin is an anti-diabetic that will not cause. Now, what are the side effects of metformin? Whenever we give metformin to a patient, the important side effects of medicine can be this will cause vitamin B12 deficiency. Medicine can cause vitamin B12 deficiency, can result in lactic acidosis. Most common side effect is nausea, and this medicine can cause diarrhea anytime during the treatment. So on and off diarrhea. So medicine can cause vitamin B12 deficiency, can result in lactic acidosis, nausea and diarrhea. So important side effects are vitamin B12 deficiency, lactic acidosis, nausea and diarrhea. Diarrhea is on and off, can start anytime. This is the side effect of metformin. Next is patient has got a pituitary tumor and having a growth hormone excess. So again a case of acromegaly. Acromegaly hai, what is the first line treatment? So the first line treatment is octreotide. Octreotide we have discussed already, is a first line treatment that we can use. Next is, okay, there is a drug leuprolide here. Leuprolide is a gonadotropin releasing hormone. This is a gonadotropin releasing hormone analog, and this is the medicine of choice. This is the medicine of choice for the delayed as well as precocious puberty. This is the best medicine for delayed as well as the precocious puberty. So leuprolide is a medicine which is a GnRH analog. This is the best medicine for delayed as well as the precocious puberty. Now, UJP regimen is an outdated regimen. This is an outdated regimen for emergency contraception. So this is an outdated. So here you people have to tell me what is the most commonly used medicine for emergency contraception. So most commonly used medicine these days for emergency contraception is levonorgestrel. So levonorgestrel, the dose is 1.5 milligram. So this is the most commonly used medicine and the most efficient medicine. Most efficient medicine for emergency contraception is ulipristal. So ulipristal is the most efficient medicine. 30 milligram can be taken up till 5 days and levonorgestrel can be taken up till 3 days. So the above MCQ is old MCQ, but nowadays this is more important to know which is the most commonly used medicine for emergency contraception. That's the levonorgestrel. Most efficient drug for emergency contraception, that's a ulipristal. Ulipristal is SPRM. It is a selective progesterone receptor modulator and levonorgestrel is progesterone analog. Next is diabetic patient started on some drug. Diabetic patient को कोई drug start किया and the patient HbA1c level has gone down, but she is complaining of itching around the vulvovaginal area. So she has got an infection. She has got an infection in genitals. So which medicine you have started? So we know that the medicines are canagliflozin. They are the SGLT2 inhibitors. These medicines can result in glycosuria. They will result in more amount of glucose in the urine. So can result in infection like vulvovaginitis in female, can result in Fournier's gangrene, can result in Fournier's gangrene in male, can result in UTI, can result in perineal fasciitis, can result in perineal fasciitis. So all these problems can occur. Now the question which is important for this year exam, these are the anti-diabetics that will cause euglycemic diabetic ketoacidosis. So these are the drugs that will increase the risk of euglycemic diabetic ketoacidosis. This is something important. Yes, Abhinandan has said that they can also cause fracture sometime. Yes, this is correct. They can also result in bone fracture. These medicines can also result in bone fracture. But the question इस बार आएगा वो ये है कि which anti-diabetics can cause euglycemic diabetic ketoacidosis. So euglycemic diabetic ketoacidosis caused by canagliflozin. Now we have a drug linagliptin. Now linagliptin is a medicine. This is a DPP4 inhibitor. This is a DPP4 inhibitor and it's the only DPP4 inhibitor which is safe to use in CKD. So linagliptin starts with Li. Linagliptin starts with Li. This is metabolized by the liver. Linagliptin DPP4 inhibitor, safe to use in CKD, metabolized by liver. Now the liraglutide is a GLP-1 analog. Liraglutide is a GLP-1 analog. So we have two medicine. One is liraglutide, one is semaglutide. So liraglutide, semaglutide are the two medicines. They are the GLP-1 analogs. They are the GLP-1 analog medicines and they have also got the approval for obesity. They have got approval for obesity. But if question asked to you, what is the drug of choice for obesity? So the drug of choice for obesity is tirzepatide. Drug of choice for obesity is tirzepatide. So tirzepatide is the best medicine for obesity. Tirzepatide is a dual analog. It's a GLP-1 and GIP analog both. So tirzepatide is the best medicine, but liraglutide, semaglutide, they are also given for obesity. Okay. Now again, I think they have asked a question on growth hormone. So again, a question on same gigantism, acromegaly. What is the first line drug? Again, the same question is repeated. Octreotide. Octreotide is answer. Next is patient has taken emergency contraceptive pill levonorgestrel and she can take the medicine within 72 hours. We discussed already. She can take the medicine within 72 hours. Now female will have the breast cancer, which is a SCRM that we can use. So all the medicines which are SCRM, they end with the word fen. So here the best answer is raloxifene, but tamoxifen is a better answer here. And the important side effect of tamoxifen is this medicine can increase the risk of endometrial cancer. So the important side effect is endometrial cancer, can result in cataract also. So tamoxifen is SCRM. This is given for breast cancer. Can result in cancer, can result in cataract. So cataract and cancer are two side effects. Raloxifene is mainly given for osteoporosis. Raloxifene is mainly given for the treatment of osteoporosis, right? Now, the female who is pregnant got a thyrotoxicosis at 7 weeks of gestation. So first trimester. So first trimester of gestation, female has got thyrotoxicosis. The answer is propyl thiuracil. If the female is in second, third trimester, the answer will be carbimazole. So carbimazole is the best medicine in second and third trimester, and propyl thiuracil is the best medicine in first trimester. So thyrotoxicosis, best medicine in first trimester, PTU, second, third trimester, carbimazole. So these are the some important topics on which the MCQs are based. But because of lack of time, we couldn't discuss. So I request you that at least for the topic of endocrine and the anti-cancer, you please read your notes, because we people haven't got the sufficient time to revise this topic properly, right? And with this, I'm just winding off this today's session. I hope you people have liked the session. Approximately 100 MCQs we have discussed, and we have tried to cover all the important topics. So guys, keep on studying well, and our wishes are with you. In case you have any problem, message us anytime. Be in contact with us anytime. My all wishes are with you. Come up with the flying colors, then we'll do the party. Okay, na? Enjoy करेंगे life को. And we have so many other things to do in our life. This is just a starting, just a beginning. Take care of yourself, guys. Jai Hind.